Did you tune in to LAFCO to hear your eulogy?
No, but I heard it sounded like one, so I gotta check that out.
Good morning and welcome to the May 10th, 2022 meeting of the Santa Barbara County Board of Supervisors here in Santa Maria. Madam Clerk, please call the roll.
Supervisor Williams.
Here.
Supervisor Hart. Supervisor Nelson.
Here.
Supervisor Lavenino.
Here.
Chair Hartman.
Here. Please stand, join me in the pledge. Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next is approval of the minutes from May 3rd, 2022 meeting. May I have a motion and a second, please?
So moved.
Any further discussion? All in favor say aye.
Aye.
Any opposed? Passes unanimously. Do we have a CEO's report? CEO Miyasato?
We do, Chair Hartman. Just a quick announcement that our Santa Barbara County Public Works Department was recognized recently with an achievement award from the National Association of Counties. And since 1970, the award has honored innovative, effective county government programs that strengthen services for its residences. The County Public Works was recognized by NACO for its resource center, which, as we know, optimizes new technologies and other innovations to advance the county's energy goals and environmental stewardship. The Resource Center is the first operation in California to house a materials recovery facility, an anaerobic digester, compost management unit, and landfill all at one location. And so congratulations again to our Public Works Department for that recognition.
And I heard the Union of Concerned Scientists had a tour there and were very impressed as well. So congratulations to Public Works. Madam Clerk, any announcements?
Chair Hartman and members of the board, I do have a couple of quick announcements this morning. We posted an addendum to today's agenda on Friday, May 6th, adding a closed session item and administrative item number 26 to our agenda. The additional closed session item is conference with legal counsel, existing litigation, paragraph 1 of subdivision D of Government Code section 54956.9, Christopher Anderson et al. Versus County of Santa Barbara et al., Santa Barbara County Superior Court, case number 22CV01299. Additionally, we added administrative item number 26. Administrative item number 26 is from the first 5 Santa Barbara County Children and Families Commission. It is to consider recommendations regarding an amendment to Chapter 41 of the County Code. This is the second reading of the ordinance that was inadvertently left off of the agenda prior to publishing on Wednesday evening. We also received a memorandum from the Behavioral Wellness Department yesterday, Monday, May 9th, requesting to withdraw administrative item number 2 from today's agenda. Administrative item number 2 is from the Behavioral Wellness Department. It is to consider recommendations regarding a First Amendment to the Agreement for Services of Independent Contractor with Telecare Corporation, fiscal years 2019 to 2022. Next, I would like to remind the public that the Board of Supervisor meetings are being interpreted and broadcast live in Spanish. We are broadcasting our meetings in Spanish, both for Cox Cable subscribers in South County, as well as Comcast Cable subscribers in North County. Members of the public can now view our meetings in Spanish by turning on the secondary audio programming, also known as SAP, under their language settings. That information is currently being provided through the TV scroll. Lastly, I would like to remind the public who are participating in our meeting today of the board's updated methods of public participation. For the Board of Supervisors methods public participation and to provide public comment, general public comment, or an item on the board's agenda, please see page 2 of the agenda. Members of the public can attend meetings in person, both in the Santa Barbara Board Hearing Room chambers, as well as the Santa Maria Board Hearing Room chambers. Please note the board is following all local and state guidelines and are no longer requiring face coverings indoors. If you attend the board meeting in person, you will no longer be required to wear a face covering, but please be advised that the Public Health Department is still strongly encouraging all county staff and members of the public to mask and socially distance themselves in crowded areas. I would also like to remind the public, if you require any special accommodations, please contact the clerk of the board to make that request, preferably on the Friday prior to the board meeting. Individuals that would like to provide verbal public comment virtually may do so via Zoom by registering in advance via the link available on page 2. After registering, you will receive a confirmation email containing important information about joining the virtual meeting. Once the chair has announced the item you want to comment on, please join the meeting with the information provided in the registration confirmation email. You will be placed on mute until it is your turn to speak. The clerk will call you by name. When removed from mute, you will hear a notification that your line has been unmuted. If you are using a touch-tone phone, you may need to press *6 to unmute yourself. Each person may address the board for up to 3 minutes at the discretion of the chair. If you have any questions, please contact the clerk of the board's office at 805-568-2240. We've also received public interest in departmental item number 4 regarding an ambulance service contract policy resolution and update. And our estimated start time for that item will be at approximately 10:40 a.m. this morning. And that concludes my announcements for today.
Thank you, Madam Clerk. Turning to our administrative agenda, are there any items that any board members would like to pull for discussion? Supervisor Williams?
I'd like to pull A8.
A8, okay. And Madam Clerk, are there any members of the public who've pulled an item?
Chair Hartman and members of the board, we have no requests from the public.
Would you read A8 into the record, please?
Chair Hartman and members of the board, administrative item number A8 is from the Human Resources Department. It is to consider recommendations regarding modifications to COVID-19 workforce provisions.
Supervisor Williams?
Well, as much as all of us would like to leave COVID behind, we have not eradicated the disease. And I respectfully disagree with the idea that we should rescind our vaccination or testing policy. County workers are emergency workers, and we will get another wave. Hopefully it will be smaller. There will be people who get sick from that wave. There will likely be people who die from that wave. And if our policy with our workforce can help diminish the numbers, then we should do so. I would consider it appropriate to go to a biweekly or bi-monthly testing instead of weekly or something like that to reduce its cost or reduce the burden on the employees that do not choose to get vaccinated. But we're supposed to be there for the public. We're supposed to be there for them in a way where we can respond to emergencies and respond to their needs without getting them sick. And so I just think removing this is would be premature and not respectful of that mission that we all as county employees have.
Are there any further comments related to this? Supervisor Lavenino?
I was just going to say, if you want a special vote on this, I'll move the item.
Thank you. Yeah, I haven't.
And I'll second. Madam Clerk, would you call the roll?
Supervisor Williams?
Yeah.
Supervisor Hart?
Aye.
Supervisor Nelson?
Aye.
Supervisor Lavenino?
Aye.
Chair Hartman?
Aye.
Motion passes 4-1.
Okay, I would now entertain a motion to approve the balance of the administrative agenda, including the withdrawal of item A2 and the late addition of A26. May I have a motion?
So moved. Moved the balance of the agenda. Withdrawal of item 2, A2, and the addition of item A26.
Second?
Second.
Oh, that was a question. Second? All in favor, say aye. Aye. Any opposed? Passes unanimously. Madam Clerk, would you read into the record administrative item number 23?
Chair Hartman and members of the board, administrative item number 23 is sponsored by Supervisor Nelson. It is to adopt a resolution of commendation honoring Leroy Scolari for his extraordinary contributions to agriculture and the Santa Barbara County community. And I will now read the resolution into the record. Whereas Leroy Scolari was born in Longpoke and was a member of the Longpoke 4-H and an original member of the Junior Livestock Sales Association with the Santa Barbara County Fair, and from a young age proudly served his community. And whereas after graduating with a Bachelor of Science from UC Berkeley, Leroy served in the Army during the Korean War as an engineering instructor and later established the agriculture program at Allen Hancock College and held a teaching position as an original instructor. And whereas Leroy helped write the county general plan agriculture element in the 1980s and served on a number of committees, including the Ag Element Committee as chair from 1980 to 1992, the Agricultural Grading Ordinance and Trails Committee, the Santa Barbara County Fair Director from 1992 to 2002, the Santa Barbara County Agricultural Advisory Committee as a founding member, the president of the Santa Barbara County Farm Bureau, the Santa Barbara Sheriff's Committee Rural Crime Advisory Committee, and the California Association of Resource Conservation's Districts Board. And whereas Leroy was honored as the Santa Barbara Cattleman of the Year in 1987 and the Director's Choice Award from the Santa Barbara County Fair Board of Directors in 2003, and served for 20 years on the Board of Directors for the Cachuma Resource Conservation District, and continued to serve as the acting treasurer secretary until the time of his death. And whereas Leroy Scolari was known for his can-do attitude, staunch advocacy for continued stewardship of the land, dedication to agriculture, and education of youth, all of which have created a lasting legacy in the county of Santa Barbara. And now therefore be it hereby ordered and resolved, this Board of Supervisors commends Leroy Scolari for his extraordinary contributions to the community, passed and adopted today.
On behalf of my dad, I'd just like to thank everybody. Also, he was a real member of the community. He did a lot. Thank you.
And what an extraordinary legacy indeed. Madam Clerk, turning to item number 24, would you read that into the record, please?
Chair Hartman and members of the board, administrative item number 24 is sponsored by Supervisor Lavenino's office. It is to adopt a resolution proclaiming May 6, 2022 as National Nurses Day and the week of May 6, 2022 through May 12th, 2022 as National Nurses Week in Santa Barbara County. And if I can have anyone receiving the resolution for this item come to the podium, and I will now read the resolution into the record. Whereas the American Nurses Association and Santa Barbara County Public Health Department celebrate Nurse Week with the theme, "You Make a Difference," and acknowledge the value and difference nurses make every day toward improving the health status of our community. And whereas for over 2 years, Public Health Department nurses have been on the front line in the battle against the COVID-19 pandemic and continue to save lives by ensuring access to COVID-19 testing, vaccination, and education. And whereas Public Health Department nurses, as disaster workers, have displayed resilience, courage, and dedication in serving patients, families, and our community as they responded to devastations from the COVID-19 pandemic. And whereas Public Health Department nurses are the vital link and make a difference by positively impacting health disparities among our most valuable populations. And whereas Public Health Department nurses are essential to the healthcare team and make a difference by influencing and shaping health policy decisions that ensure our community has access to high quality and equitable care. Now, therefore, be it hereby ordered and resolved that this Board of Supervisors does proclaim the May 6th, 2022 as National Nurses Day and the week of May 6th through 12th as National Nurses Week in recognition of the contributions of all nurses working in the County of Santa Barbara, passed and adopted today.
Dr. Reynoso.
Good morning, Chair Hartman and members of the board. Thank you for this opportunity to recognize a very critical part of our team. So public health has 77 LVNs, RNs, and other nurses, and we throughout our department. And this is a wonderful opportunity to recognize them. But I would be remiss in not also calling your attention that to other departments that also have nurses. So we are also taking this opportunity to recognize nurses in Be Well, in Department of Social Services, in probation, in the Sheriff's Department, and in the Fire Department. So we have a lot of nurses in our county, and we can't do our work without them. And for today, though, I would like to call out a few special noteworthy accomplishments of our public health nurses. And joining me on Zoom is Paige Batson, our Deputy Director of Community Health, and Yvette Calhoun, our Nursing Director.
Good morning, Chair Hartman and members of the board. Thank you again for recognizing nurses every year during Nurse Week. These past 2 years of Nurse Week recognition have been special, given the amazing contribution that each and every nurse in the public health department has given in our fight against COVID-19. From the beginning and still today, public health department nurses have been on the forefront of this pandemic, whether partaking in screening, testing, vaccination, contact tracing, isolation, and quarantine. Hence, I want to congratulate our dedicated nurses for their resilience, commitment, and care for our community members. Thank you.
And then we also have Yvette.
Good morning, Chair Hartman and members of the board. I'm actually at an event with some of our nurses right now, training for Nurses Skills Day. So excited and honored to work with these skilled nurses who are truly willing to committed to our community. I think the nurses who come to the county and stay at the county all have one thing in common, and that is their commitment to the community and the work. So we're working here to keep their skills up so that they can help support the community. Again, thank you so much for the resolution, and I wanted to have them give some applause. That's them. All right, thank you.
Thank you.
Thank you.
My mother was a nurse, and it's become a very wonderful profession, and we need more nurses. But you can travel and get pretty good pay and pretty good hours. I think we even have a board member whose daughter aspires to be a nurse and will soon be entering college to study it. So it's a great profession.
I'll just take that opportunity to brag on my daughter, Avery Nelson, who will be attending Boise State officially now in the fall, majoring in the pre-nursing program. So
good for her. Madam Clerk, would you read item number 25 into the record, please?
Chair Hartman and members of the board, administrative item number 25 is sponsored by Supervisor Lavenino. It is to adopt a resolution proclaiming the week of May 1st, 2022 through May 7th, 2022 as Compost Awareness Week in Santa Barbara County. And I would now like to invite Mr. Bob Engel up to the podium.
I just contacted his office and he was incommunicado. So they thought he was here. So why don't we just move on with something else? And then hopefully if he shows, we can come back to the resolution.
Okay.
Is that okay?
We're going to trail this item.
I
Is that
believe,
correct?
if that's okay.
Sure. So that takes us to general public comment, and Is there any member of the public who would like to speak on matters not on today's agenda, but within our jurisdiction?
Chair Hartman and members of the board, we have 2 requests to speak here in Santa Maria. I will call our first speaker, Erica Coley, to be followed by Yolanda Navarro. Ms. Coley?
Good morning, honorable chairman and fellow board members. My name is Erica Cully, and I am a resident of Santa Maria. I will be brief in my comments today, as I know you and I both have a busy day. I am not here as a resident or a constitute, but as someone who provides for those families and chooses to live here in Santa Barbara County. It's truly a pleasure to stand here in front of you. Maybe you may recognize me or remember me, but most likely you don't. I was here back in March, echoing the importance for all counties in California to invest in the care economy and to prepare for what's heading our way. This brings me to why I am here today. It is truly a privilege and an honor to stand in front of you. More importantly, to have the reassurance that when worker speaks up, this current board of supervisors listens and acts. I mention this because it's evident that you heard us back in March, and we know that this board of supervisor has chosen to prioritize the future of our elderly and disabled. Home care workers through the in-home supportive service program have a tough job, and many cannot handle this line of work. Providers work hard day in and day out, and the toll of this job is not physical, but also mentally draining. However, we do this work with compassion and because we care. The least we want to do is to get home and worry about bills, wages, and what will my family do if something was to happen to me. That is why today, on behalf of the thousands of IHH workers and our union, the Domestic Workers of America, we would like to extend our utmost gratitude and appreciation to the Santa Barbara Board of Supervisors for their leadership and their decisions to invest in this workplace. In this workforce. For providers like myself, this truly gives us a sense of security about our financial future. It's also clear that, it's also clear that this county supports essential services and invests in workers like me. Essential programs like this one truly can change someone's lives. Recipients receiving service live independently, workers are employed, and ultimately both the county and the state saves money. Again, we thank you and look forward to continuing this relationship and to attend future Board of Supervisors meeting. This concludes my public comments on behalf of the home care workers of Santa Barbara. Thank you.
Thank you so much for coming. Ms. Navarro?
Okay. Buenos días. Buenos días y miembros de la Junta. Mi nombre es Norma Alonso y soy residente de la ciudad de aquí de Santa María. Seré breve en mis comentarios y estoy aquí como residente construyendo trabajo y supuesto proveedor y manteniendo a mi familia elegir vivir aquí en el condado de Santa Bárbara. Es un placer estar aquí frente a ustedes y un poco nerviosa, pero agradecida que ustedes decidieron apoyar a los trabajadores domésticos. Más importante que ustedes, la mesa directiva del condado de Santa Bárbara apoyó sinceramente a personas con discapacidad mental, personas de la tercera edad, son prioridad. Nuestra comunidad sale adelante mejorando cuando nos aseguramos de que los demás vulnerables tengan buena salud en su hogar, familias sólidas y experiencias positivas. Es por eso es importante todos los condados de California inviertan en la economía de la ciudad y se preparen para que se avecinen. Los trabajadores de atención domiciliaria a través del programa de servicio Apoyo en el Hogar, IHC, tiene un trabajo difícil y muchos no pueden manejar esta línea de trabajo. Los proveedores trabajan duro día a día y el costo de los trabajos no solo es físico, sino también mental. Muchos de nosotros encontramos nuestra pasión haciendo el labor y realmente es un trabajo, pero para otros no hay otra opción y tienen la responsabilidad deben de cuidar a su familia. Sabemos que la necesidad del cuidado en nuestra comunidad sigue creciendo y ustedes apoyando un nuevo contrato va a ayudar a más personas entre hacer lo que hacemos nosotros. Es por eso que hoy, en nombre de los miles de trabajadores de IHSS y nuestro sindicato UDW en América, nos gustaría extender nuestro mayor agradecimiento, aprecio a la Junta de Supervisores de Santa Bárbara por el liderazgo y su decisión de invertir en esta mano de obra. Para proveedores como yo, nos da una sensación de seguridad sobre nuestros futuros financieros. Muchas gracias.
Thank you.
That was our final speaker.
All right, then turning to departmental item number 1. Would you read that into the record, please?
Chair Hartman and members of the board, departmental item number 1 is from the Public Works Department, Board of Directors, Laguna County Sanitation District. It is a hearing to consider recommendations regarding a Laguna County Sanitation District ordinance relative to service charges, connection charges, and trunk sewer fees, and resolution relative to collection of service charges on the tax roll. And this is in the 4th and 5th districts.
Thank you. Ms. Wells?
Good morning, supervisors. This item is staff's recommendation for fiscal year 22-23 wastewater service charges, connection charges, and trunk sewer fees for the Laguna County Sanitation District, which services the Orchid community. And Marty Wilder, the district's manager, will be making the presentation today.
Good morning, Chair Hartman and directors of the board. This is the annual consideration for rates and fees for Laguna Sanitation District. So what is Laguna County Sanitation District? It's a dependent district of the board created in 1958. It provides wastewater services to Orchid and the unincorporated area of Santa Maria, and is regulated by basically lots of permits for collection systems, the treatment plant, brine waste, laboratory, air pollution control, et cetera. Current activities. As you may know, we're well underway with our phase 1 plant upgrade, which is to replace the existing older infrastructure, mostly built in 1960. Recycled water distribution project to Waller Park is nearly complete. And we've completed several phases and are beginning another phase of a sewer system, or basically our trunk line lining projects. So this annual rates and fee ordinance is being considered today. It was noticed pursuant to Prop 218 requirements. The mailer went to nearly 13,000 customers on 10,900 parcels. The hearing dates were published as required, including government code, required newspaper notices in the Santa Maria Times. And we did have a small number of written protests and comments, approximately 65 total comments. Sewer charges. So sewer charges pay for annual operation, maintenance, and replacement, as well as reserves. Those revenues are collected on the tax roll. And this year, a 1.5% rate increase is proposed per our 5-year rate study. We're in year 3. For comparison, the consumer price index based on the annual average was 3.8%. The actual charge per residential unit equivalent as a measure of standard measurement comparison to other agencies is an annual amount of $1,104.98. Last year's rate was $1,088.65, which is a $16.33 increase for the year, or equivalent $1.36 per month. Commonly, you compare their agencies by month, so the monthly rate would be $92.08. Multiple family residential units such as mobile homes, condominiums, and apartments are a reduced rate of $897.60 per year. Schools are billed at $57.32 per capita per year. And commercial fluctuates due to type of facility, restaurant, retail, et cetera, and is based on the amount of waste flow and load. How Laguna compares countywide is shown because we do treat to tertiary levels in addition to advanced treatment for using reverse osmosis to remove and reduce salts. The rate at 9208 is a little more than average, which is $73.70 per month. I do like to include a total water comparison, which is potable water plus sewer together. I had mentioned we do advanced treatment, and some agencies do that, but through their water department. So for more appropriate comparison, water and sewer together is $145.44 with a countywide average of $164.70. This action also addresses developer charges and fees, which are paid for by development for system equity buy-in, basically for their fair share of capacity. Trunk line fees fund collection system improvements, and the connection charges fund treatment plant and discharge improvements. The developer charges and fees are adjusted by indexes, either addressed in ordinances or in one case, a development agreement with for reimbursement to the developer. The connection charge per residential unit equivalent based on the construction cost index at 7.6% will be $9,070. Whereas the two trunk line fees, one a Laguna trunk line fee, also adjusted by the consumer construction cost index at 7.6%, is $1,158 per residential unit. The Bradley trunk line fee is the reimbursement agreement with the developer, and the agreement addressed to tie that to the prime rate, which is 3.25%. It would therefore be $2,999 per residential unit equivalent. A couple more pictures of the plant upgrade process, or how we're coming along. And basically today we recommend adoption of the rates and fees for next year.
Do board members have any questions for Mr. Wilder? Seeing none, how many protests were filed?
We had 65 comments, but of those 4 were valid protests.
Okay. Is there any public comment, Madam Clerk?
Chair Hartman and members of the board, we have one request to speak here in Santa Maria. We will now go to Chuck Williams. Mr. Williams?
I live in Old Town Orchid. My sewer bill is $1,600 a year. Thank you, Bob Nelson and Peter Adam. Before you increase this sewer tax again, please give me a good explanation of why the increase. Peter Adam implemented a 1.9 automatic increase so that the plant manager, Mr. Wilder here, would not have to keep coming back to the trough and asking the board for more money. Now you're back within 3 years, asking for an additional 1.5%, bringing my sewer bill total to an additional 3.4% per year. That's ridiculous. This is outrageous. When approved, I will be paying 5.4% on my property taxes. You are taking complete advantage of homeowners with your authority if you pass this bill. Current homeowners should not have to pay for future development or pet projects. This tax has to have a legitimate termination date. My sewer bill will soon cost more than my home is worth. Supervisor Nelson, I went into your office over 2 years ago to talk with you and Peter Adam in private regarding the Oasis Community Center. Peter left early that day. I asked you at that time about my sewer rate increase of 1.9% annually. It's outrageous. You said, quote, "Chuck, I promise I will take the increase off as soon as I can," unquote. Why should I believe you again? I know what I heard then, and I know what I heard prior. And you know what you said in both cases. My age has nothing to do with what I heard you say, which you denied saying, then started apologizing profusely to me for misunderstanding what I thought you said. You said it, Bob. You said it. You and I started off pretty good about 10 years ago. Unfortunately, the last couple of years I have turned to not trust your word, learn to not trust your word. You know exactly why I feel the way I do. I do not trust you or this entire quid pro quo board. Like Peter Adams said before the last 1.9% rate increase, quote, "It's a done deal and there's nothing you can do to stop it. Sewer fees is the only, unquote, sewer fees is the only way I can get things done," unquote. This is perfect examples of government quid pro quo corruption. Thank you.
Thank you.
And that was our final speaker.
Thank you. And so we bring it back to staff. Are there any further comments?
Chair Hartman and directors of the board, no further comment. His rate, Mr. Williams' rate, apparently is based on either multiple units on the property or commercial. I have to look at it specifically if that was requested.
And just one quick question. I mean, we typically do this every year. It's not and it reflects cost of living adjustments. Is that not?
Chair Hartman, directors of the board, that is correct. In fact, the most recent series of adjustments were based on a 5-year study to address inflationary costs. The prior increases were fairly significant, but they were to pay for the plant upgrade primarily. So once we got to that point to address reserve debt service and reserve requirements, et cetera, then we set up this 5-year plan. We're now in year 3 to make an attempt to maintain costs as applicable based on inflationary electricity, labor, et cetera.
Thank you. Supervisor Nelson.
Yes, thank you, Chair Hartman. The rates have gone up in the Orchid area probably over the last 10 to 14 years, right? And the reason behind that, can you kind of go into that? Because it was a plant that was built again in 1958, but then there needed to be some major upgrades
Sir, public comment is now closed.
Due to the need to comply with certain state standards on treatment and whatnot. Can you speak to that just a little bit, Hardy?
Chair Hartman and directors of the board, and Director Nelson specifically, the treatment plant was built in 1960. Capacity increased in 1974, another one in 1986. However, the one in 2001 was a regulatory compliant required plant upgrade to address basin plant objectives for salt. Basically, Santa Maria and Guadalupe had to address those through other means by buying state water. Laguna was not able to do that, so we did a fairly significant upgrade at that time. The current upgrade is a total replacement of the 1960 plant. Typical useful life is 40 years. We're at 60 years, so it's a total redo of the existing plant. Other agencies such as Longpoke, San Luis Obispo, and others have undergone very significant increases up in the $140 million range and have had adjusted rates as well. Other agencies a little less so. Can't speak specifically for Santa Maria, but they do have 3 times the customer base and low technology treatment processes. It's my understanding that it's a matter of time before something equivalent will occur there too. So yes, today is rate just to keep up with inflationary indices and to keep the rates set at a point where we can, like I said, pay our debt service on the current construction project.
Thank you, Mr. Wilder. And I just want to make that point because, this is good stewarding of our public assets is what I firmly believe here. And that's why I support this increase. The other portion of it is I think that Marty and his team have been excellent fiduciaries while inflation's gone up by 3.8% over the last year, they're still only asking for 1.5%. And just to put that into scale, what that means to the ratepayers is if they were to ask for consumer price increase, which is common on a lot of other districts, and I think we saw in the presentation, that'd mean another $273,000 in fees paid by Orchid residents. So having that 1.5% increase, I think is fair and addressing the added costs that are necessary to maintain it. It shows that you and Ms. Hagan and Ms. Wells have done a really good job putting a plan together for the future of the plant. And of course, I would love to see this to go away, but at this point, we got in trouble because we did not increase sewer fees for many years in the Orchid area. And so I think that this board is doing its fiduciary responsibility on making sure that we are keeping up with the cost of maintenance. If we don't maintain things, they fall apart, and then we need to rebuild them, and it ends up costing the taxpayers a whole lot more. So with that, that's one of the reasons why I will be voting to approve this item, and I'll move that here in a moment. The other thing I did want to address is I did get there was quite a few comment letters, as Mr. Wilder said. Only 4 of them were valid because part of them came from mobile home parks. And the way it works is mobile home parks, it's the property owner, the park owner that has the vote. And so I want to make sure that the residents in the mobile home parks know that I heard their concerns. One of the things that they need to look at as well, though, is that, as Mr. Wilder pointed out, is that mobile home users and certain users only pay a percentage of this. So we're really talking about $1 a month per mobile home increase this year. So I know that there's people on tight budgets and fixed incomes, and I empathize, but I do think that this is a fiduciarily responsible activity. So no other comments. I'll move this item.
May I have a second?
I'll second.
All in favor, say aye.
Aye.
Any opposed? Motion passes unanimously. Madam Clerk, would you read item number 2 into the record, please?
Chair Hartman and members of the board, departmental item number 2 is from the Public Works Department. It is a hearing to consider recommendations regarding a County Service Area 12 Mission Canyon Sewer District resolution relative to collection of sewer service charges and sewer connection charges on the tax roll. And this is in the 1st District.
Ms. Wells.
So Chair Hartman, members of the board, this item is to set the charge for wastewater services in CSA 12, which is the Mission Canyon community. Staff is proposing no change to the existing rates, but it's required to bring this item to your board to adopt a resolution to set the charge each year. We do have a presentation for your board, but we can skip the presentation if you'd like to save time. It's up to you.
And this is in the 1st District?
Correct.
I think we can skip it.
All right. Great. So we have the recommendation to you today for approval of the resolution to set the charge for the CSA 12 wastewater service charges.
Okay, may I have a motion? Oh, any public comment on this item?
Chair Hartman and members of the board, we have no request to speak on this item.
So may I have a motion for staff recommendation A through C in our board letter today?
So moved.
Second.
All in favor, say aye.
Aye.
Any opposed? And Supervisor Williams wasn't here for the vote. Madam Clerk, would you read item number 3 into the record, please?
Chair Hartman and members of the board, departmental item number 3 is from the Public Works Department. It is a hearing to consider recommendations regarding establishing benefit assessments for county service areas 3, 31, and the Santa Barbara North County Lighting District for fiscal year 2022 to 2023.
Ms. Wells again.
Chair Hartman, members of the board. So this item is before you to approve resolutions to establish benefit assessments for fiscal year 22-23 against CSA 3, 31 in the North County Lighting District for street lighting services. Again, staff is proposing no changes to the existing rates. We do have a presentation to share with you, but we can waive the presentation if you prefer.
Let's see, this is in all districts, but since there's no change and I don't see any board member asking for the presentation, we could waive it.
Great. So we ask your board to approve the resolutions to set the benefit assessments for the street lighting.
Madam Clerk, any public comment?
Chair Hartman and members of the board, we have no request to speak on this item.
So may I have a motion to approve the recommended actions A and B in the staff report?
So moved.
May I have a second? All in favor, say aye.
Aye.
Any opposed? Passes unanimously.
Madam Chair, members of the board, I'm sorry, did you say A and B or A through E? I just was trying to.
A and B, and then it's 1 through 5 in my.
Oh, 1 through 5 in the board
Yeah.
letter. I just want to make sure
B
it was all the
includes-
items.
Yeah, B
Okay.
includes 1 through 5.
Ah, thank you.
So that brings us to item number 4.
Chair Hartman and members of the board, departmental item number 4 is from the Public Health Department. It is a hearing to consider recommendations regarding an ambulance service contract policy resolution and ambulance service update.
And we have oh, yes.
And Madam Chair, before we start, can we just take a 5-minute break to reset our staffing for this?
Sure.
Thank
Okay.
you.
5-minute break. We're running a little early today, but we'll take a quick break. We're reconvening the May 10th Santa Barbara County Board of Supervisors meeting here in Santa Maria. We're at departmental item number 4. Madam Clerk, would you read that into the record, please?
Chair Hartman and members of the board, departmental item number 4 is from the Public Health Department. It is the hearing to consider recommendations regarding an ambulance service contract policy resolution and ambulance service update.
And turning first then to ex parte communications, who would like to go first? Supervisor Lavenino.
Thank you, Madam Chair. On March 16th, I met with representatives of AMR. They expressed concerns with the length of a requested extension. I met with fire chiefs on March 24th and also May 4th, where they expressed concerns that I think are pretty well summed up in the May 9th letter from Chief Hartwick.
Supervisor Hart.
Well, I have a lot of ex parte communications because this is a complex issue over a very long period of time. So I met with Dr. Del Reynoso and Nick Clay on August 19th, 2019. And on May 2nd, 2022, had also had a meeting with Dr. Del Reynoso about the same subject. And then I met with County Fire, Chief Hartwig, as recently as May 9th. 22. And then also my chief of staff met with Chief Taylor and Supervisor Hartman on May 9th, 2022. And I met with Brian Fernandez from the County Firefighters Association on May 9th. And on May 2nd, I met with the Fire Chiefs Association. And on March 18th, I also met with the Fire Chiefs Association. And then in September 3rd of 2019, I met with the Fire Chiefs Association and the local fire unions. And then I met on June 24th of 2019 with representatives from AMR and consultants Jeremy Schumacher, David Sherman, Mike Saunders, and Molly Culver. And then on February 16th, 2021, I also met with AMR representatives. And then August 23rd, I met in 2021 with AMR representatives. And then April 20th of this year. And then I met with the AMR union representatives on September 6th of 2019 and April 7th of 22. And I also met with the Falk ambulance folks, Julian Drewberry and Troy Hagan on May 14th of 2021. I think that's everybody.
Supervisor Williams.
So some of the dates I may cite as ex parte may have had no communications about this subject. Just I'll say in particular about ones that I'm certain were, and I'm not disclosing ex parte communications with our own public health department because they're not a party to the RFP. On Wednesday, January 6th, I met with Molly Culver and AMR on Zoom. On Wednesday, July 21st, this of last year. These were both last year. I asked as part of my fire board duties, I asked Chief Hartwig if AMR had what the possibilities of AMR co-bidding with the chief's fire proposal was. On Monday, August 23rd, I met with Molly Culver and AMR in person. On Thursday, October 28th, 2021, I asked Chief Hartwig, again, as part of my fire board duties, if how Kuyama would be treated in the RFP process and proposals. Wednesday, March 16th, I had these are essentially the bi-monthly meetings. I do not think we discussed it, but I'm just going to put that out there anyway. Friday, March 25th, 2022, I met with the Fire Chiefs Association about the ground ambulance process in person. Tuesday, March 29th, 2022, I met with Molly Culver and AMR in person about the contract extension and their reluctance to grant a contract extension. Friday, April 8th, 2022, I met with the union for the paramedics and EMTs, Local 70, about advantages and disadvantages about current situation. Wednesday, April 20th, 2022, I had a meeting with Chief Hartwick. I do not think I discussed any of this at that, but I am citing it anyway. Monday, April 18th, meeting with Chief Taylor in person. I definitely discussed the upcoming ambulance contract with him. Thursday, May 5th, 2022, meeting with the Fire Chiefs Association. That was last week. And yesterday, I met with Brian Fernandez, head of the Firefighters Union, about this discussion today. I'll just say that most of them, except for the meetings with most of these are regular meetings that we set up on multiple issues with our chiefs.
Supervisor Nelson?
Yes, I don't have all the dates here, but I do meet with the fire chief monthly, CEO weekly. I've had 2 meetings with the county chiefs, 2 meetings with fire, from the Fire Association, Brian Fernandez. I've met with AMR on 2 occasions, as well as Terry Mosnisich. Met with the AMR Labor Association twice about this. I do have some additional experience from my time as a staffer, learning about this issue and looking to possible solutions.
Oh, Supervisor Lavenino.
Yes, I have 2 ads. I met with Brian Fernandez on April 13th to discuss the issues, and also met twice. I don't have the dates with the local EMT union.
And my ex parte are just for this year that I have. March 16th, regular check-in with Chief Hartwick. March 21st, with the county fire chiefs. March 29, Longpoke Fire Chief Welch. March 30, President of the Santa Barbara County Fire Union. April 13th, regular meeting with Chief Hartwick. April 25th, with the local 70 paramedics. May 4th with AMR. May 4th with the fire chiefs, May 9th with Chief Taylor, and May 9th with the president of the Santa Barbara County Fire Union. And basically, I think the issues summarized in the May 9th letter cover the issues that we discussed with county fire. And again, AMR was the extension and the kind of service and flexibility that they offer. So with that, County Council, did you have anything you wanted to add?
No, Madam Chair, not at this time.
Okay, we're ready for staff presentation. Dr. Del Reynoso.
Great. Good morning, Chair Hartman and members of the board. Presenting with me today is Mr. Nick Clay, Emergency Medical Services Agency Director, and Dr. Danny Shepard, Emergency Medical Services Agency Medical Director. Joining us via Zoom is Mr. Thomas Moore, our consultant from Fitch and Associates. Your board approved a contract with Fitch Associates to assist us in crafting the Ambulance Services RFP. Mr. Moore is the Director of Emergency Medical Services for University Medical Center Health System in Lubbock, Texas, and he serves as a Senior Associate for EMS, Public Safety, and Healthcare Consulting firm Fitch and Associates. His professional healthcare experience includes designing, implementing, and managing ground ambulance services, managing hospital emergency care system and trauma centers, and providing consulting leadership for strategic planning, consolidations, mergers, acquisitions, and RFP processes for healthcare and government procurement for transportation services. Our presentation today will provide information for your board's consideration of 3 critical areas in EMS. What we present to you today is a culmination of efforts over the past 5 years, beginning with a countywide collaborative process to review and redesign the EMS system. On October 1st, 2019, your board directed us to design a competitive RFP for ambulance services based on the outcomes of the EMS systems review. To fulfill your board's direction through a collaborative process, the Rfp Advisory Committee, with technical assistance from local, state, and national experts, designed an RFP that prioritizes achieving the best clinical outcomes, that provides a comprehensive approach to countywide delivery of services, that seeks innovation to address complex inter-facility transport issues, and an RFP that complies with the state EMS direction. Our hope is that your board will find that the RFP and the process presented today will deliver these key goals. Before I transition to Mr. Clay, I want to thank County Council, in particular Rachel Van Molen and Brian Pettit, for their guidance throughout this process. Also, in the room and on Zoom are members of the Rfp Advisory Committee. Mr. Clay?
So today before you, we have 3 recommended actions. First, to approve the attached resolution, attachment A, adopting a policy setting forth issues to be considered for inclusion in contracts for provision of emergency ambulance services entered into or renewed on or after January 1st, 2022. Approve and authorize issuance of a request for proposals, RFP, for an exclusive ambulance services provider for the Santa Barbara County exclusive operating area. And last, authorize the Public Health Department to negotiate and return to the board for approval of 5th Amendment to the Professional Services Agreement with American Medical Response West, AMR, extending the termination date to allow for completion of the ambulance services RFP process. Sorry, thanks. So quick overview of AB 389. AB 389 went into effect January 1st, 2022. It created 2 new state statutes, 1797-230 and 231. In addition to solidifying the alliance model, the public-private partnership for ambulance service, it also requires the County Board of Supervisors to establish a written policy setting forth issues to be considered for ambulance agreements entered into or renewed on or after January 1st, 2022. Lastly, to clarify, AB 389 does not alter, modify, abridge, diminish, or enlarge the requirements for creating an exclusive operating area as outlined in 1797-224. Issues to be considered in the resolution. AB 389 presents a limited number of examples. The EMS agency has added additional elements, all of which were presented in the RFP to the Rfp Advisory Committee for approval and inclusion within the RFP. In the resolution presented to your board for approval, we have included the following issues for consideration for ambulance agreements: employment retention requirements, disaster response and preparedness, minimum qualifications for the bidders, diversity and equity efforts, financial requirements, cost recovery mechanism for the county, community engagement, outreach, and education requirements, emergency takeover replacement provisions in the event of a major breach in the agreement, ongoing workforce development, and staffing levels and compensation requirements. These issues were considered and have been included in the ambulance RFP and are also present in the existing ambulance agreement. Despite being able to complete the procurement and selection process prior to the end of the current agreement with AMR, there is still a timing issue as a new provider would need sufficient time to ramp up in advance of service delivery should a new provider be selected by the RFP review panel. While a long ramp-up period is of benefit to the incoming provider, it creates a challenge to the outgoing provider as they must maintain contractual deliverables while their staff transition to a new provider. In developing the ambulance RFP, a review of the recent ambulance RFPs was conducted to determine an appropriate ramp-up period, supply chains and COVID notwithstanding. After review of the average and consultation with Fitch & Associates, it was determined that a 6-month ramp-up period would be appropriate, again, excluding the impacts of both COVID and supply chain. Supply chain challenges. Ambulances were made to order, and the global supply chain has limited quite a number of elements required for development of ambulances. In review of discussion with ambulance manufacturers, the current situation is about a 12 to 16-month lead time. However, potential bidders have indicated they could be ready in as little as 1 to 8 months. LEMS has extended the ramp-up period to 11 months, which does not include an intent to award or contract, does not include the 2 months between the intent to award and a contract presentation to the board. Just would like to pause and briefly turn it over to Thomas with Fitch Associates to add anything with regards to supply chain issues.
Good morning. Thank you, Nick. Yes, so the healthcare industry represents roughly 20% of the U.S. economy at present. And what we've observed as a firm nationwide is that healthcare is experiencing the same supply chain and logistical challenges that other industry sectors are experiencing, which are lack of materials, lack of individuals to load and then transport those materials and then unload them at their destination, along with several core line materials that are used to make capital assets used in pre-hospital emergency medicine, such as ventilators, cardiac monitors, AEDs, suction devices, and a range of other things.
Thank you. So next, just a brief overview of kind of where we've been. When we met in October of 2019, 3 years seemed like a lot of time to complete an ambulance RFP. That said, we find ourselves in position today where 3 years was just almost enough time. So how did we get here? The COVID pandemic began to impact the EMS agency staff in February of 2022. However, despite these impacts, we proceeded with developing the Rfp Advisory Committee, which we'll go into more detail shortly. In August, Citygate was selected by the Rfp Advisory Committee. However, shortly thereafter, out of an abundance of caution, the Rfp Advisory Committee recommended the contract be terminated. We quickly began working with Fitch, who was a second runner-up in the consultant RFP. And by January 2021, we were beginning work on the RFP. By November 2021, we had a draft ambulance RFP, which was released for a potential bidder comment. And then a question about the boundaries of the UCSB campus prompted the EMS agency to clarify the status of the exclusivity of the UCSB campus with the state EMS authority. The authority stated that the area known as the UCSB campus was non-exclusive and it could be made exclusive by including it in the RFP. The Rfp Advisory Committee provided guidance to include it in the single exclusive operating area. Then in February 2024 or February 24th, 2022, the EMS agency sent the final draft to the state EMS agency for approval. And on May 3rd, they provided their approval. And on May 10th, we're here today to present this for your final approval. A look at what the timeline looks like should the RFP be approved for release today. It would be released by tomorrow. The responses would be due by July 11th of 2022. They would be evaluated by an independent, non-interested group of EMS experts and community leaders. The intent to award would be made on August 24th. The EMS agency would present the contract for your board's approval on November 1st of 2022, which would then allow for 11 to 13-month ramp-up period and new service delivery starting on October 1st, 2023. As mentioned, the current agreement with AMR extends or expires at the end of this year, December 31st of 2022. In order to make the October 1st, 2023 service date start date work, you would need a short-term extension with AMR. In order to finalize the ambulance RFP, initial conversations have been had with AMR. And while we have not finalized our agreement, we have every reason to believe we'll be able to present an agreement to your board by June. Should the RFP timeline be delayed, it may negatively impact the negotiation timeline with AMR. To be clear, the Public Health Department has not formally engaged in negotiation discussions until authorized by your board. What if there's a gap in service? While we don't anticipate being in a predicament of having a gap in service, it is important to acknowledge this scenario could occur. There are several reasons in which this scenario could occur. Legal challenges could halt the RFP process. Supply chain issues could cause a greater delay in the ramp-up period. The county and AMR could not reach an agreement to cover the gap. There are no responsive bids to the ambulance RFP. Negotiations with the winning bidder are protracted, and the state is unable to review the resulting contract in timely fashion. Each of these scenarios contain their own variations, so it's difficult to predict a solution to each one of these variations. That said, the EMS agency staff are confident that with the support of our EMS system participants, we can manage every one of these potential scenarios. So some key goals of the ambulance RFP. As presented in October, as part of the EMS system review in 2018, the triple aim was a significant element of our ambulance RFP, which focuses on patient experience, population health, and system cost. The EMS agency itself values community access and education, provider safety and support, as well as clinical excellence. And lastly, the 2018 EMS system review, which included input from over 60 providers from all disciplines of the EMS system, included 23 system initiatives, which were presented and included in the ambulance RFP.
The RFP Advisory Committee, we started this process. I recall our first meeting. It was after your board directed us to initiate the RFP process on October 2019. We established an advisory committee to define the scope of work and to select the RFP consultant to provide policy level direction on ambulance RFP. And I recall the first meeting, I actually was in the EOC because we had been activated to respond to COVID-19. The RFP throughout, we met, and it consisted of the Assistant CEO, myself as the Public Health Director, the Public Health Department Deputy Director, Paige Batson, and the Behavioral Wellness Director. The committee staff that supported us with their expertise included staff from the EMS agency, Fitch, County Council, County Procurement, and County Risk Management. We provided policy level guidance on the RFP. Some of the examples of the work or the discussions and the guidance included ambulance RFP procedural timelines, ambulance RFP amendments as requested by California EMSA, approving the financial requirements of the proposers, defining the boundaries of a single EOA, validation of response time requirements, support for innovation in the medical health patient and interfacility transport systems, ensuring diversity, equity, and inclusion was included for the providers and patients, staffing requirements in the ambulance RFP, and confirmation of clinical standards set forth in the ambulance RFP.
So some key elements of the ambulance RFP and how they crosswalk with the current 2005 agreement. As we discussed going into the RFP in 2019, we talked about how well the system currently works. And while the ambulance RFP incorporates new ideas and innovation, it also strengthens and enhances a number of existing elements of the current ambulance agreement. Response times were made standard throughout the county. Currently, there's a 2-minute extension for areas with ALS subcontracts, meaning that if an ALS fire department arrives in advance of the ambulance within 7 minutes and 59 seconds, the ambulance has an additional 2 minutes to respond for a total of 9 minutes and 59 seconds. This is in addition to several other agreements in which the ALS fire department has a 7-minute response time standard with the EMS agency. To shift, the 959 is moving towards an industry standard with other counties, as we'll look at it in the next slide. Subcontracts are allowed. However, the exception is that there's no delays in the ambulance response time. We also shifted from 3 operating zones to 1 contiguous zone for the county. And there is no change in the interfacility transport boundaries. Just a brief review of ambulance response times across the state and recent RFPs and contracts. As you can see, that even the 959, this is a response time standard for urban areas for Code 3 responses. And as you can see, the 959 response time for lights and sirens response in urban areas in Santa Barbara County is still among the faster of other counties. It's important to note that there are 2 counties, Contra Costa County and Sonoma County, that have different requirements for different areas. In this graph, we've shown their fastest or their lowest response time requirement. Community access and education is an important component of the EMS system. The ambulance RFP calls for bidders to present innovation in the areas of IFTs and mental health transports. That said, The EMS agencies also aim to increase the level of accountability on response times for both mental health and interfacility transports. Increased requirements for diversity, equity, and inclusion, training and specifically addressed. Additionally, the EMS agency staff work with Public Health Department's Health Equity Coordinator to ensure we captured ambulance service, this element in the ambulance service through a health equity lens. Focus on the patient experience by enhancing the requirements for patient surveys. We also focus on enhancing population health and community education, asking for a community event innovation and requiring one major community event per year. We require 24/7 access to translation service. While providers do have various means to access this service currently, it was important to make it a requirement. Also, a quick note on community education, that numerous studies have shown community involvement and early bystander care improves patient outcomes for the most serious of cases, such as cardiac arrest and stroke. On provider safety and support, we've increased the shift maximum to accommodate the more remote areas from 48 hours to 60 hours. However, we have lowered the threshold for which ambulances are classified as busy, essentially their unit hour utilization. We've also added a rest requirement for the busier units. We standardize a training platform, aligning with the fire department's current training platform. We focus on enhancing employee wellness and safety requirements. Next, I'll turn it over to Dr. Shepard to discuss the clinical excellence requirements in the RFP.
Good morning. I'm Danny Shepard. I'm the EMS medical director. I'm also a physician staffed at Santa Barbara Cottage Hospital, Goleta Valley Cottage Hospital, board certified in emergency medicine, but also board certified in EMS as a subspecialist. When we moved towards the designing the RFP, our goal was to how could we improve the patient experience and the end user, the patients, the quality of the care they receive. When the board, when your board directed us to go to RFP, we discussed that we had a very highly functioning EMS system. So especially our specialty care systems, benchmarked against the West region of the United States, we have a very high functioning stroke, heart attack, trauma systems that consistently perform at or above national averages. And we really wanted to maintain that system. And how could we, and the goal was, how could we move the needle? How could we create a system that would create even more value for our patients? And so discussing it internally, we felt like we really had to focus on clinical excellence and the care that patients receive at the time they call 911. They trust us implicitly. So they at a time of an emergency, they don't get to consider a lot of times. They have to call 911 and they're looking for help. And so we want those who arrive to provide the best care possible. A lot of our system is based on initial interventions, but also getting the patient to the appropriate facility for definitive care. So we really strove. Our goal was to design an evaluation system that looked at the care our providers are providing on scene with the patients and what really is going to improve their care on scene, but also, once they go to the hospital, hopefully improve their outcomes. So as I stated, the emphasis is really on patient outcomes and what the patient experiences when they call 911. In general, if you look at all calls, faster response times aren't generally associated with better clinical outcomes or care. And I think it may sound counterintuitive, but if you think about it, if you're at a restaurant and the server is there quickly, but then completely bumbles your order, you might be satisfied that you were served quickly, but then you're quickly frustrated. No one would argue that EMS is equatable to an experience at a restaurant, but if we want our providers to provide definitive care initial interventions, but also their clinical acumen and the way they apply their scope of practice can have huge impacts in the care the patient receives. So if you are displaying stroke symptoms, or if you potentially have a stroke and they arrive quickly but don't recognize the signs of stroke, you're taken to the hospital. You might be taken to a hospital that doesn't provide stroke care, or they don't realize. So if you come to a stroke center, if the ambulance identifies that you're potentially having a stroke, they will notify them on when they call in saying, have a potential stroke alert. So that the emergency department's ready, the neurology team may be there. We take you directly to the CT scanner. Everything's done in preparation to administer treatment. If the stroke or other condition is not recognized, then you go through the triage process, you may be placed in a room. So there are downstream delays that can compound that the initial misdiagnosis that could result in 10, 20, 30, even more prolonged delays. So it's really important that initial interventions are applied appropriately, but also that emergency conditions are recognized and patients are treated appropriately to their clinical impression. And that's sort of the goal of the RFP, is to hold the contractor accountable for the care that their employees provide, and that the patients are getting the care that is intended through the medical control and sort of policy development process. And in order to do this, we're going to use a clinical compliance tool similar to what we used with response time compliance monitoring, but now evaluate clinical compliance. We write all of these policies and procedures for our pre-hospital providers to perform in the field. Now we will look at how they apply those policies and procedures to patients. And so we've developed a tool, a clinical compliance tool, that we will be able to deploy it and evaluate in sort of real time the care that the patients are receiving, so we can optimize their outcomes.
Just add that we talk about innovation as a part of the RFP. I think this is a great example of how even in advance of the RFP, we've been able to develop an innovative solution. First Watch is an industry leader when it comes to data aggregation and data management. And they've been very quick to apply a current existing platform of response time compliance and apply that to patient care and clinical compliance. So it's been an exciting, quick maneuver on the innovation front.
When the providers themselves will be able to look at their performance and how their providers are performing in the field, and allow us to incentivize them to provide good care. So your providers are following the policies and procedures, they're providing good care, so we can incentivize you and reward you for that. And they would discount fines that they may receive for late arrivals. But similarly, poor performance would be they'd be accountable for that poor performance. And I think it really just creates a culture where we're encouraging our providers to provide good clinical care. And if a patient has a concern about their care, saying that, oh, well, it looks like they arrived quickly, everything was okay, I think that would really dissatisfy a patient. They don't feel justified by that response. So being able to look at their care that they received and have accountability and say that this is what we're looking at in real time can really improve the patient experience, but also the care that they're being provided.
That ends our presentation, and we are available for your questions.
Thank you. Supervisor Hart.
I had a question about the status of negotiations with AMR about a contract extension for a short period of time. I understand that was in the works just as recently as last week, and just wanted to know the update on that.
Supervisor Hart, Madam Chair, we are in initial discussions. As mentioned earlier, we haven't received the authorization to officially renegotiate a short-term extension with them. Although all conversations so far have led to a successful conclusion of that. I think given the definitive start date of a new contract is really sort of that key component to understand how long the extension needs to be, which is why these are brought together. So we have a definitive start date for the RFP or the new service date, and then a definitive end date for that short-term extension.
From my perspective, this is a key piece of what we're doing. And, the presentation shows how complex this issue is and how many moving parts there are. And, everybody's working together to get us the best possible service for the patients that need this emergency care. And I really appreciate the great working relationship that we have with AMR over decades, and, their exclusive operating agreement with the county, and the fact that had been grandfathered and renewed, for many, many years, I think led the board to unanimously decide, we wanted to do an RFP to understand, what else is out there as options, and, really to do our fiduciary responsibility of checking in to find out through a competitive process what other
services could potentially provide, what AMR could do more aggressively to help our local residents. And because of COVID, we've had a little bit of a hiccup in the process, and that, it's not just this thing, it's the world. And, I think we just have to recognize that reality. And a couple of things that Mr. Clay said that, made me pause a little bit was, talking about making the timeline, assuming the supply chains are solid and work, and that, we almost have enough time. And yet this has taken 3 years. So I personally think I'd like to know that, AMR is willing to work with us and do this short-term contract extension that makes sense for everything that we're all trying to accomplish together to get a fair, equitable, competitive RFP process that, works with the timeline for AMR to continue operating the ambulance services, or for us to make a transition. And I'd like to know that, now. I'd like to know that soon, before we really weigh into this whole RFP process. Because I think it sort of speaks to, the partnerships that we have and the viability of those. So from my perspective, we're ahead of the game here, having a substantive conversation about the RFP until we have that contract extension in place, so we know what the timetable is going to be. We know how this orderly process is going to work out. So I'd like to see our board, just hit the pause button and say, let's come back in 2 weeks after we've had a successful conclusion of those negotiations with AMR, and know, what we're doing here over the next year.
And I would just like to jump in that I agree. It seems to me that we have the cart before the horse. And at least when I spoke with AMR representatives, they said it was 4 or 5 years. 5 years is what they were insisting on. And so I think 12 months is what we're looking for. And so that seems to me quite a distance apart, and that really frames many of the questions and how we would really look at the RFP. I'm somewhat disappointed that that this went to the state and now it's back to us. And I understand that COVID and the short timeline and the pressures that everyone was under, but that again seems to me like it limits our discretion in ways that I resist. And so I don't want to make that same mistake again. So I agree with Supervisor Hart that I would like to postpone a full discussion of this until we know that we really have a contract in a short-term contract with AMR. Supervisor Nelson and then Supervisor Williams.
Yes, thank you, Chair Hartman. And I share those frustrations as well, but I think we still need to have a bit of a discussion here, because that timeline, the 10-month extension we're looking at right now, only exists if we put this out into bid tomorrow, right? That's the timeline. And that means taking this RFP and moving it forward. I'm not satisfied with this RFP. So I know that's going to be additional delays. So, how do we negotiate with AMR on a contract when we don't know which RFP they're going to get, what is going to go up the street? So that's the part I think we need to build into that time frame, because if we are going to.
Would you state that again? I'm not sure that I understood it.
So the RFP that we have right now, the 10-month time frame includes this RFP hitting the street tomorrow. Well, I'm not okay with this RFP. So that's going to take us negotiating what that looks like among the 5 of us, because it's our RFP at the end of the day. We're the decision makers. We own this RFP. We want it to look like our fingerprints on it. So we're going to negotiate that among the 5 of us. It's going to go back to the state at that point, then come back to us, and then go to the street. So we're talking a couple, 2, 3, 4 months. I don't know what that looks like. And so I do think we have to have some type of RFP discussion so that we know what the negotiations look like with AMR, because that extends the time frame, the ramp up period is what I'm imagining. I might be wrong, but that's kind of why I think it's important for us. And we can have the discussion in 2 weeks. That's fine too. Maybe AMR is willing to have an open-ended contract with us so that we can get through this time process. That's something I guess I'd be open to. But I think we do have to have this discussion, because I'm not okay with this RFP. I mean, I have some questions for Dr. Shepard, because I am concerned about the cardiac stroke side of this thing. I understand his points about making sure we have better clinical care, but I know response times are hugely important. And I'm really uncomfortable where we're going with this RFP. So I'm looking forward to having more discussion with all of you about that.
Supervisor Williams and then Supervisor Lavenino.
So I understand your question, but I will disclose that I've had the same thought that Supervisor Hart and Hartman have had, even though I'm not Brown acted with them separately. And so I just now learned that they've had this thought independently. And the reason why I have had this thought is simply because I do not appreciate sort of the level of leveraging and brinksmanship on AMR's part. I feel like at this point we have this sort of very strange situation where they came to me a number of months ago and said, basically, take us for 4 or 5 years or we're going to drop you. And I want to know if that's the case or not. I gave them plenty of reasons why they shouldn't, and why they should agree to another extension. But and then by not giving us an answer before this hearing, that is just simply another attempt to leverage us harder, right? If we might have some real problems in this RFP, well, we can't fix those because otherwise we won't get the extension, right? I don't think we should be governed by a contractor attempting to leverage us. I guess that is why I would like to understand too, whether the 10-month extension will be agreed to or not. That to me is the most important clarification.
Supervisor Lavenino.
Well, thank you, Madam Chair. This is weird because we don't get to talk to each other about these issues, so we're all kind of having the same coming to this independently. My goal is to just get this done right, and it doesn't feel like we started off on the right foot. And as far as the timeline goes, let's think about something. I mean, this was a 30-year contract that we basically had. We took 3 years to get to put together an RFP for a number of reasons, which I understand. I don't think we have to rush into this. I need, as far as AMR, whether or not it's brinksmanship, look, they're going to do what every company does, and that is what they're charged with doing, which is they have to defend their turf, and they've got to do what's in their best interest as well. So I don't begrudge them that. It puts us behind an 8 ball right now. And so, the way I see this is we have to establish a deadline to get that extension. If we don't, and we walk out of this meeting and say, well, go get the extension before we have the hearing, there's no incentive for, at that point, AMR to come to the table. So I kind of heard the same things that when I met with AMR, they wanted, and they brought up a number of very good reasons, legitimate concerns, why they wanted a longer extension than the 10 or 12 months that was being offered. But then I heard through the grapevine, like 2 weeks later, that they had agreed to an extension. And so now it sounds like they haven't. So it's all very confusing. I don't want to go through this entire RFP and talk about all the problems that I have with it and the questions that I have with it until we know where we stand in this negotiation. And right now we're walking blind. And so I would support setting a deadline of, it needs to come back to us at a certain time with this extension. If the extension, at that point, we have to make a decision as a board. If it comes back and AMR decides that they can't do that, it's not in their best interest and they want to walk away, then we have to make some really hard decisions and move quickly. My guess and my hope is that they would agree to that extension. And And then it puts us in a much better position at that point to figure out exactly what this RFP is going to look like. And I also agree with Supervisor Hartman that having to go to the state, and I don't know what, I'm not familiar with what it had to do by law. I would have much rather seen it come to us first and have this meeting first and then go to the state, because now it feels like it's going to come to us. Anything we change, I'm assuming has to go back to Cal EMSA. So that's, just takes longer, but I do have some other serious concerns with the RFP, but I'd rather we deal with those in a later date.
Supervisor Hart.
Yeah, I just think that Supervisor Lavenino has exactly right. I have confidence that we're going to be able to work through these issues in a short period of time. It sounded like we were really close. And there's nothing like a deadline to focus folks' attention. And I think, this is an opportunity to demonstrate that we're going to continue to collaborate through this process and get to the right result. And there's a great saying about, do you want to do it now or do you want to do it right? And I think we need to do it right. And 2 weeks is not much of a delay in all the schedules involved. I think we can actually, stick pretty close to the schedule that we originally had by just having a 2-week delay to get this contract extension to make everybody comfortable.
Supervisor Nelson, what are you thinking?
Yeah, so we still need to have a contract that does built in us changing the RFP as a board. So I'm not willing to move forward if the extension doesn't include that. So,
and is that we're going to come back in 2 weeks and start where we are today in 2 weeks.
So if we have a 10-month extension, which is what is being negotiated right now, and then we decide in 2 weeks that we're going to change the RFP, then we're going to need another extension.
Not really. I don't think so, because the dates we're talking about are the 2023, the end of 2023. So we have a lot of time, but we don't have a lot of time if the contract ends at the end of 2022.
And we were thinking initially of a 10-month extension. We could put in 12-month, not to exceed 12 months or 12 months to accommodate an opportunity for the board to fully vet the RFP.
Okay, so I'm getting a little more comfortable because I want to make sure, because if we have this tight schedule, which I think is what we were shown, there wasn't room to go back to the state.
Right. And I think we're all agreed we want to put our fingerprints on the RFP and we want to carve out time to be able to do that.
So I think it also helped to hear from staff if they could, would the year extension allow for both those things to happen?
Supervisor Nelson and Supervisor Hart through the chair. Anything's possible. I think the challenge is just going to be the requests that come in or the changes that come in and how the state interprets them and what their turnaround time is. It's sort of an unknown to us. So if the state has concerns or issues with any of the proposed changes, that could just extend and lengthen that time. So while, from 10 months to a year may be reasonable, depending on the changes, it may not allow enough time for the state to review or for us to engage in a conversation and address those changes you request.
Supervisor Hart.
And I appreciate that. I think that's a smart thing for a staff member to say. We don't know, and it could take longer, but it hasn't so far, and we can go forward and deal with it if we have to change it. But today we have a tight time frame, and we're proposing to have less of a tight time frame. And that's a good thing. So
then I think what I'm hearing is that the board would like to have a contract nailed down with AMR, a short-term contract, before we actually deliberate on the substance of the RFP. County Council, did you have something you wanted to add?
Well, Madam Chair, members of the board, I do think it might be helpful to take a break and just consult with staff on the timing, just so that we can have a few minutes to outline the process to see. I think if giving direction on extending the contract, it might be good for the direction to include a little leeway as we just a couple months, just as we figure out that process. And then also I wanted to mention, so one of the actions before your board is the policy for under 389, AB 389. Any renewal needs to be consistent with the policy. So you could either, but the policy can be more general than the RFP, right? So any of the specifics you're concerned about, you can when we bring the RFP back, you could address it then. But on the policy, if you had concerns about that or wanted maybe to delete anything from the policy, you could either give that direction today or when it comes back. But then the staff would be negotiating just consistent with those general terms of the policy. So I just want to make sure.
Yeah, for myself, I would like to do a really careful crosswalk between the policies and where in the RFP and how those policies are reflected. And then look, are there things in the RFP that aren't reflected in policies? And I haven't really done that crosswalk yet. So I would like to wait on a discussion of the policies till we have an opportunity to do that. So we will take a short break, but I think the issue is also, we have many people here who would like to speak. We could limit it to speaking merely on the continuance, but another option that I would favor is to listen and to listen carefully to what people have to say and then go forward. So could I see nods about that. Okay, so we will take a short break. 10 minutes, will that do it? After a short break, we're reconvening the May 10th, 2022 meeting of the Santa Barbara County Board of Supervisors here in Santa Maria. And we wanted to hear from staff about the schedule. So Dr. Del Reynoso?
Yes, Chair Hartman, we will come back in 2 weeks and we will work to negotiate a short-term extension with AMR. It probably will be more realistic to look at a 12 to 4 months extension rather than a 10. And we anticipate that depending upon changes from your board to the RFP, those changes may add an additional.
That 6 months was, it's hard to anticipate what's going to happen, but, we come back in 2 weeks and at that time, hopefully we have the extension. You make comments on the, adopt the policy, but make comments on the RFP. The staff incorporates the changes. It goes off to the state. That's an unknown period of time. Then our question was, okay, what if the state makes changes and it comes back? You may want to see it again, right? And so building in that time, not knowing exactly how long the state would take, and then not knowing what comments they'll come back with. If they're very minor, maybe it'd be fine to move forward. But if it's something really significant, we thought your board might want to see it again. So that was part of the 6 months, is we have some unknowns there, and we wanted to, staff heard from the board that you wanted to not just move forward without hearing from you. So they're trying to accommodate all of that time.
Right. There are a lot of unknowns here. What if we hold this, go to public comment and come back? So Madam Clerk, how many, County Council?
And Madam Chair, just one more thought. So I'm hearing from the clerk that the 5/24 meeting is very full. So depending on the time frame for this item, it's already at 9 hours. So just something to think about, whether it's 2 weeks or maybe there's another item on that agenda that can be moved. I'm not sure.
And yes, and could we ask our CEO to look into that and during public comment?
And Assistant CEO Terry Mustis is on Zoom, so she could maybe address that when we come back.
Okay, so let's go to public comment. Madam Clerk?
Chair Hartman and members of the board, we currently have 11 requests to speak. And we will first go to Mr. Todd Larson on Zoom, to be followed by Mr. Greg Fish here in Santa Maria.
Hi, can you hear me?
Yes, Mr. Larson, go ahead.
Hi, I'm Dr. Larson. I'm the medical director of Santa Barbara County Fire and Carpinteria Summerland Fire District. Also the medical director of Ventura College Paramedic Program and Oxnard Fire, and the chairman of emergency medicine and the assistant medical director at St. John's Regional Medical Center and St. John's Hospital Camarillo, and board certified emergency medicine. So I just wanted to be here and let the board know that both the department and I have very high standards. I'm very proud of the paramedic programs that are in our county. We have a very progressive EMS department in the fire services. There is a large focus on quality. We have an excellent team set up to deal with pre-hospital care in our fire departments, and that we are excited to be looking at increases in quality assurance in the field. I also did want to note, I noticed some of the supervisors were mentioning that they were concerned about the lack of response times in the contract. I would say that while response times are certainly not a harbinger of outcome in and of themselves, obviously a 5-minute response time versus a 30-minute response time makes a very big difference in patient outcomes in the field, something I certainly see as an ER physician. And I just wanted to assure everyone that the county fire is a very excellent paramedic provider, and that we are excited about possibly increasing our responsibilities and have a focus on CQI. And I'm available to speak with anyone at any time if you would like.
Thank you, Dr. Larson.
We will now go to Mr. Greg Fish here in Santa Maria, to be followed by Santa Barbara City Fire Chief Chris Males.
Madam Chair, distinguished board members, I am Greg Fish. I currently serve as the president of the Santa Barbara County Chiefs Association, and I am also the fire chief of the Carpinteria Summerlin Fire Protection District. So thank you for your time to hear from us today. Over the past 15 years, and more specifically over the recent 5 years, the fire service has approached public safety from a collaborative standpoint. Gone are the days when each department operated independently in silos. The fire chiefs in Santa Barbara County operate from a priority system that ultimately puts the communities we serve first. We understand the value of unity and are aware there are significant advantages by working together as one unified fire service. Some examples of these unified collaborations include one that's going to be coming up in early 2024. A common dispatch center will be stood up that will send resources immediately to the required location, regardless of borders and boundaries. That's something we're very proud of. Also, you can just go back in time within the last 4 or 5 years and look at the mutual aid responses to large incidents and disasters within the county. That, to name a few, the Thomas Fire, the debris flow of 1/9/2018, and of course, the COVID disaster management and response that the fire service has managed. One of the many benefits of embracing innovation in the fire service is more creativity and better decision-making, which results in varied perspectives. One example of such innovation is what is happening in community-based paramedicine. In my previous post as the Glendale Fire Chief, the city of Glendale delivered a variety of creative solutions in the emergency medical realm, such as alternate destination for lower acuity patients, reducing hospital readmissions by assigning them a specially trained paramedic to monitor patients at home, and homeless outreach teams where police and fire personnel work together to assist those who were unhoused. There are a variety of other community paramedic options that would serve this county well, like mental health assessments, sobriety and suicide prevention response, disaster response, like COVID testing and vaccination, and mobile integrated health that involves a stakeholder partnership amongst area hospital staff, fire department, law enforcement, public health, and social services personnel. The reputation of outstanding service delivery to the communities we represent is a hallmark for what we stand for. To be sure, the fire service in Santa Barbara County is willing and able to deliver superior and appropriate emergency medical services long into the future. If given the opportunity, we will use all of our collective resources, energy, and talent to stand up the best EMS system possible. I'd like to thank you for your time.
Thank you, Chief Fish.
We will now go to Santa Barbara City Fire Chief Chris Males, to be followed by Montecito Fire Chief Kevin Taylor.
Good morning, Madam Chair, distinguished members of the board. My name is Chris Males. I'm the fire chief for the city of Santa Barbara Fire Department. I've been an EMS provider in this county for 37 years. Today, I finally stand before you with the opportunity to engage in transformational change of our EMS system. This morning, I'd like to focus on transparency and how important that is to our EMS system. However, first, I'd like to articulate 2 instances where we had a lack of transparency. First, our fire department is conducting a comprehensive deployment analysis termed a standards of cover study. We're analyzing our response data over multiple years to gain an in-depth understanding of when, where, and how our resources are deployed to emergencies. As part of that study, we requested 3 years of data from the LEMSA. What we received were response times with no correlated incident address, no ability to even drill into a neighborhood for analysis. The LEMSA's defense was that providing this was a violation of HIPAA. However, there was no attempt to assist us with a reasonable alternative to evaluate response times in even a zone or an area in the city. The data provided is unfortunately unusable to us, and we cannot not analyze any ambulance response in the city of Santa Barbara. Another glaring example of the lack of transparency is the number of ambulances provided or not provided in our system. Private ambulance providers strive to have the minimum number of ambulances on duty to maintain contract compliance. The deployment of private ambulances is considered a trade secret and/or proprietary business practice. Not one fire chief in this county knows the deployment of ambulances in our respective communities. Now for the good news. A fire-based ambulance transport system would immediately utilize a fully accountable staffing model. There will be free flow of information and data regarding the deployment in all areas of the county. Each community will be a stakeholder in the provision of services. A nimble and reflexive deployment team will be able to make near immediate changes to ensure continual high levels of ambulance coverage and resulting in exemplary response times. Rapid response as an integrated fire service-based model will be the pride of our county. We will continually meet our mission to provide the right resource to the right patient at the right time. We will strive for 100% compliance with established response time standards. There will be no trade secrets and no proprietary business practices. Again, we will be a model of transparency. This preeminent state-of-the-art service will be overseen by your trusted public servants, the women and men of the county fire departments. Thank you.
And I have a quick question for you. So that would be transparency on ambulance deployments real time?
Yes, absolutely. We'll do our best, but the public would know exactly what the deployment at all times is in any given community.
Thank you.
We will now go to Montecito Fire Chief Kevin Taylor, to be followed by Ms. Shauna Jorgensen.
Good morning, Madam Chair, distinguished board members. I'm Kevin Taylor, Fire Chief of the Montecito Fire Department. Thank you for the opportunity to comment on this important topic this morning. The Santa Barbara County Fire Chiefs believe that direct assignment of ground ambulance service to county fire aligns well with the county's values: accountability, customer focus, equity and inclusion, innovation, trust, and ethics. I want to talk a bit about trust and ethics, the cornerstone of government. We will achieve trust and validate ethical behavior through the creation of our Community Advisory Group. Facilitated by County Fire, the Community Advisory Group will consist of program stakeholders that includes first response providers, labor representatives, educational institutions, hospitals and receiving facilities, mental health providers, and substance abuse providers. The purpose of the Community Advisory Group is to inform our program's objectives, identify gaps in service or the continuum of care for their customers and our customers, and to develop actionable methods to address each of these issues. The Community Advisory Group will have a voice with our program of services, continually informing our system of modifications that they need, sometimes urgently, as we learned during the pandemic, to effect meaningful improvement in service delivery and outcomes. If you choose to provide this service yourself through your county fire department, you will achieve the agility to make these sometimes simple and straightforward course corrections that have an impact on the challenges that our communities face today. Challenges like mental health, substance abuse, and our unhoused community members. No one falls through the cracks. Make no mistake, in this system, the LEMSA plays a critical role. Released from the confines of what the LEMSA is allowed to do under the bid contract requirements articulated in the Health and Safety Code, the LEMSA achieves greater ability to make changes to the EMS system that promote clinical excellence and innovation. It is our steadfast commitment in this program to work closely with the LEMSA to achieve just that: clinical excellence and innovation for all of our communities. Thank you.
We will now go to Ms. Shauna Jorgensen, to be followed by Lompoc Fire Chief Alicia Welch.
Good morning, Madam Chair, distinguished members of the board. My name is Shauna Jorgensen. I am the CFO and Deputy Director for the Santa Barbara County Fire Department. In addition to operational transparency and availability, we look forward to the financial transparency that the fire department is uniquely poised to offer to our community. As a part of county government, the budget development process is held in a public forum before both the public and elected officials who represent our entire community. As a part of the county, the fire department is subject to an annual audit. Those audited financials are posted on the county website for public viewing and input. Lastly, as a government entity, we are uniquely poised as we are not subject to investor-driven revenue benchmarks that compete with our service delivery. As a nonprofit in the system, we can invest that revenue back into our community. Capital and other system investments will be driven based on board policy. County Fire, our fellow fire chiefs and partners, and all of our community stakeholders do realize that there is a great opportunity to expand the county's service delivery methods today. I am here before you because I believe that this is the right decision for our community, and the fire department is ready to do this now. Thank you so much.
We will now go to Lompoc Fire Chief Alicia Welch, to be followed by Santa Maria Fire Chief Todd Tuggle.
Good morning, Madam Chair Hartman, Honorable Supervisors, Council. I believe strongly in the board's stated core values, specifically diversity and equity inclusion. I'm Alicia Welch, Fire Chief of the Longpoke Fire Department. Thank you for the opportunity to speak today. The board's "We Are" values drive our desire to provide exceptional EMS service to our communities. Directly assigning ground ambulance contract to the Santa Barbara County Fire Department will allow our dedicated professional personnel to ensure laser focus is directed on customer needs through commitment, dedication, and dependability. Staff recruitment and retention are top priorities for each of us. I am here to clearly articulate our desire and commitment to provide premier EMS service with a lens of equity, inclusion, diversity, workforce retention, and recruitment. Directly assigning fire-based EMS delivery to us now will allow each of our departments to capitalize on diverse talent that exists right here in the county. We enjoy long, productive partnerships with community stakeholders like Allen Hancock College, Vandenberg Space Force Base, area hospitals, clinics, churches. They all feed our pool of exceptional talent. Equity reflects the ways in which we ensure equal opportunities through effective programming. Our primary role as fire chiefs is to ensure our external and internal customers feel welcome, respected, trusted, experience fair treatment, and feel valued. Creating equitable, inclusive EMS delivery requires acceptance, practice, and participation on all levels, from the Board of Supervisors, City Council members, executive boards, management, labor, and the members that you see here today. In the case of EMS delivery, a community approach to adapting to the needs of our customers is critical. Your fire chiefs are extremely prepared to manage EMS programming and delivery in this county. Diversity addresses the many ways in which we differ. Workforce diversity normally associates traits and characteristics like race, ethnicity, gender, sexual orientation, age, religious beliefs, which help us all to better serve our customers. Other traits and characteristics that these fire chiefs are interested in specific to EMS delivery are languages spoken, communication preferences, socioeconomic status, cultural norms, and family responsibilities. Our EMTs, paramedics, firefighters, officers, civilian personnel have a healthy, proven respect for our diverse client base. Santa Barbara County Fire Department's highest response incident type is by far EMS, averaging 70% of our entire call volume. Therefore, it makes complete sense to allow ground ambulance service to be delivered by your ethical, trusted county fire departments. I urge you to directly assign the ground ambulance request for proposal to the Santa Barbara County Fire Department. Thank you for your consideration.
Thank you, Chief Welch.
We will now go to Santa Maria Fire Chief Todd Tuggle, to be followed by Andrew Scouten.
Well, good morning. Thank you for having us this morning. Madam Chair, distinguished members of the board, my name is Todd Tuggle. I'm the fire chief for the city of Santa Maria right here. And I'm here to talk to you about paramedic transport services and youth in the city of Santa Maria and the county as a whole. Today, we have a unique opportunity to bolster our community's young people by offering innovative, cutting-edge programs and healthy, supportive cultures within our departments that will enable us to recruit and retain the most diverse and prepared candidates. When County Fire assumes responsibilities for the transport services in our county, our young people will win. Starting elementary school, our local fire departments are out in the schools showing the youth safety programs, but they're also exposed to a career in the fire services. Our young people see at an early age what it means to have the opportunity at a positive career path. By high school, our school's vocational programs include or can include further education towards a career in the fire service and emergency services through first aid, CPR training, FAST training, and other programs. And we are actively seeking out opportunities to educate and equip our youth with the skills, job skills, to work within a wide variety of industries in the medical services. In Santa Maria specifically, we have a significant efforts underway, such as the Mayor's Youth Task Force and Santa Maria Rec and Parks, which seek to provide our young people with viable job skills and career paths. This is yet another opportunity for them. Upon graduation from high school, county transport entity will provide the opportunity for employment in vibrant career paths. Through partnerships with our local education systems, there is a pathway to EMT basic certification, followed by job opportunities within County Fire as an ambulance operator. For those seeking additional advancement, careers exist in the transport agency, hospital setting, and other fire service careers. And again, through our local educational institutions such as Allen Hancock Community College, AT Still Physician's Assistant Program, Westmont College Nursing, Santa Barbara City College Nursing, and UCSB, our youth can continue their educational pursuits. To continue in the fire service, Allen Hancock Public Safety Training Center provides fire training to support further careers in our local fire agencies. Board action today will empower our fire agencies to provide additional critical education and career path opportunities to the youth in our community. We have a multi-pronged approach to retaining our workforce by providing various career checks for candidates to flourish in, like single role EMTs and paramedics, and career safety, fire and rescue positions, highlighting administrative and operational tracks for staff to advance as they choose. You have an opportunity before you to create an inclusive outreach for a diverse workforce, which provides the basis upon which our youth have an opportunity at true financial equity. And thank you for your time today.
We will now go to Andrew Scouten, to be followed by Santa Maria County Fire Chief Mark Hartwig.
Chair Hartman, distinguished supervisors, good morning. My name is Andrew Scouten. Today I'm speaking on behalf of the California Fire Chiefs Association, as well as the Fire Chiefs Association of Santa Barbara County. I'm a partner in the firm of Wright, Lestrange, and Gaslow. My practice focuses on antitrust, unfair competition, and ambulance and EMS laws. I previously submitted written remarks, but will focus today on an issue related to attempts to leverage the county's options. And the question is, may the county directly contract for emergency ambulance services with County Fire on an exclusive basis without relying on Health and Safety Code Section 1797.224, exclusive operating areas, or competitive bidding, and without violating the federal antitrust laws? The answer is yes. The legal issues are incredibly complicated. Don't get me wrong, but the solution is actually pretty simple. It's a four-step process. The board amends its ambulance ordinance. In the ordinance, it says that it may grant sole franchises for emergency and non-emergency ambulance services. That the county may issue licenses and permits for these services on a need or necessity basis. And whatever other policy items the board decides to include pursuant to AB 389. In the second step, the county, the LEMSA, and county fire negotiate that exclusive agreement. It comes back to the board for approval. And then following that, the county does not grant any additional licenses or permits because the services are already provided. That's it. That is the solution and the way forward. Importantly, there's no RFP and no LEMSA approval is necessary. And the authority for this solution is found in 3 statutes outside of the EMS Act. The courts have found either the statutes themselves or the courts have found that this is authorized. Finally, I want to talk, and importantly, this statutory authorization is crucial. Without that statutory authorization, there is no immunity from the federal antitrust laws. But because it's authorized by statute, there would be immunity. Finally, I just want to quickly note that there is a misconception that the only way to achieve exclusive services is through Section 224 and these EOAs. Section 224 is a permissive, optional statute. No court has ever held that it is mandatory or the only way to achieve exclusivity. In fact, in the AmeriCare case from 2018, the Ninth Circuit rejected these arguments when they were made by the plaintiff ambulance provider and state MSA. My clients are, of course, ready and able to assist the county and work through these things. And I thank you very much for the opportunity to speak with you.
Would you be willing to answer a question? You said that the authority for direct assignment lies in 3 statutes outside of the Public Health and Safety Code, if I understood. Could you elaborate on those?
Yes, absolutely. That authority is found in the Vehicle Code section 2512 subdivision C, the Welfare and Institutions Code section 14136 subdivisions E and F. It's important to understand that the EMS Act regulates EMS, but ambulances are more than EMS. They're a public transportation system. In that respect, they're similar to taxi cabs and have similar operational requirements. It's appropriate for the county government to regulate the terms in which they interact with passengers the same way. These statutes expressly allow the county to regulate ambulance services on the business side, not the medical side. And they expressly allow, or have been construed by the courts to allow, exclusive contracts, exclusive operating permits, or even non-exclusive permits that become de facto exclusive because no other permits are issued. Kind of similar to how, as I understand it, the county's waste collection system operates right now. So yes, these statutes are out there and they provide this authority. There's no need to go through all of the incredibly cumbersome procedures in the EMS Act. And these procedures would not in any way impinge on the authority of the LEMSA to maintain medical control, improve clinical performance, or any of those other functions.
Thank you.
We will now go to Santa Barbara County Fire Chief Mark Hartwick, to be followed by Brian Fernandez.
Madam Chair and distinguished members of the board, my name is Mark Hartwig and I'm your fire chief. I started in EMS in 1983 working for a private ambulance company and then have worked for a public EMS transport provider since 1991. I'm formally educated in EMS and I've had the privilege to represent the fire service at the highest level of state government and our trade association. I've been in this for almost 40 years and I believe we can do better. Today, we are a collection of good but very separate services working well together, but not at all integrated, especially between EMS, first response, and transport. The fire chiefs, as you know, have committed themselves to integrate with each other through the recently approved regional fire EMS communication centers. As you know, this will be operational in the first quarter of 2024. Thank you, and thanks to your support. Enhanced service, much needed new and existing programs, and available revenue have been at the heart of the conversations throughout this long process here in Santa Barbara County. I'd like to expound a little on these cornerstones. First of all, this county and other counties throughout California have assigned ambulance services to their county fire department. We've done it here in Cuyama and Mission Hills in the Longpoke area. And in my previous county, 7 separate communities were directly assigned ambulance transport to the board governed county fire department by the Board of Supervisors without a bid. I have provided a letter in your packet on our opposition to the proposed removal of UC or the Santa Barbara County Fire Department paramedic ambulance from UCSB and the resulting reduction in service for the 25,000, roughly 25,000 students at our world-class university. I won't expound on those concerns now. But the question is, why the county fire department and why now? We are committed to a countywide partnership with our operational area partners. There is daily interaction between jurisdictions on calls, large and small, throughout the county every day. We are fire chiefs with real-world knowledge of community service needs for our EMS and transport within our respective communities. We have a desire to better meet the needs of our hospital and behavioral health partners and colleagues in spite of not making financial sense. We as chiefs currently working in this county have a track record of building multiple and integrated health programs with our community health partners, accomplished with your support and approval. Even though not required in the RFP before you today, County Fire will enter into stop the clock agreements with our first response colleagues. The absence of stop the clock agreements as a requirement will remove $525,000 annually from the county fire department alone. It is important to make clear that revenue, that is revenue after expenses, is crucial in order to enhance levels of service with additional ambulance hours on the street of Santa Barbara County. Revenue is also required for community paramedic and co-response partnerships that we so desperately need at this time in our county's history. Revenue will be needed to add a dedicated mental health and interfacility transport fleets. We will also have the revenue needed for an emergency reserve fund, an important part of a resilient and robust EMS system. In closing, please, the county fire department, together with our operational partners, are the backbone of the county's emergency medical response system today, providing advanced and basic life support, first response, and ambulance services across the entire county. We are poised to be more integrated with transport services and improve service and operational transparency, financial accountability, and innovation. Thank you, Madam Chair.
We will now go to Brian Fernandez, to be followed by Louis Farah Jr.
Madam Chair, members of the board, my name is Brian Fernandez, and I'm the president of the Santa Barbara County Firefighters Union, Local 2046. As you look into the crowd, you will see firefighters and chiefs representing every department throughout our county. Now, usually, the only time we come together like this is when there's a major disaster or a fire ripping up a hillside that's threatening lives or homes. Today is no different. We stand before you united, as we have been over the last 5 years, asking for your support and helping us improve the service we deliver to our communities. As a fire service, we witness firsthand the shortcomings in our emergency response system. These shortcomings include, but are not limited to, a 90% compliance rate as it relates to on-scene times, and being part of a 911 system that is contracted out to provide profits for people who are not part of this community. As we have gone to the community seeking their input for an improved ambulance system, there has been one common sentiment shared amongst every person we have spoken with. And that is, why wouldn't we reinvest revenue back into our community? I would like to add, none of this is meant in any way to disrespect any of our brothers and sisters who work on private ambulances. They are our teammates, and in some cases, literally part of the fire family. Together, we have experienced quite possibly some of the worst experiences of our lives together. We see them as members of our team, and we want an improved system for them as well. Now, we appreciate that this is a challenge for the county and the board, and we also understand the perceived risks. As firefighters, there is no greater risk than endangering your life for the benefit or well-being of somebody else. As firefighters, we take calculated risks every day for the benefit of our community. And as some of our brothers and sisters here know a saying that we have, we risk a lot to save a lot. We risk a little to save a little. The bottom line for us is when considering risks, is there a benefit for somebody who we serve? Today, your respected board, I think would really benefit from considering one question. Actually, two questions. The first would be, how long are we willing to wait before we take action to reinvest into our system for the purposes of 100% compliance, co-response, support for mental health programs, and homelessness? How long? For 12 months, 6 months added on to that. How long before we really start trying to make a change to benefit the programs and the people that matter the most here? The second question would be, and this is kind of a firefighter question, is the risk a benefit to the community we serve? We understand risk. We live by them. We encourage them. And for the benefit of our community, the risk is well considered. So thank you for your time and your consideration of this.
We will now go to Luis Farah Jr. and return to Zoom with Carlos Escobedo.
Good morning, Madam Chair, distinguished board members. My name is Louis Farah, and I'm the president of the Longpoke Firefighters Association. Nobody takes more pride in the level of emergency care offered to the residents and visitors of Santa Barbara County than your local firefighters. From wildland fires and debris flows to cardiac arrest, vehicle accidents, and even lift assists, we aim to provide the absolute best care possible. It's important to understand this because our collective voice would never encourage the board to make a decision that would place lives in danger. Rather, we're constantly looking for innovative and progressive ways to provide even better care. You see, when a private ambulance responds to your home for a medical emergency, you'll most likely receive a bill for at least $3,000 in this county. You or your insurance will pay that bill to the private provider, who then uses that money how they see fit. In contrast, when a fire-based ambulance bills for service, all of that money stays here locally in Santa Barbara County. That money is then used to add more ambulances to the street, buy upgraded equipment, champion pilot programs, like some of the ones we heard today, community paramedicine, and alternative services for our most vulnerable populations. There are no corporate shareholders to appease or corporate boards based out of state calling the shots. Why does Longpoke care? Well, us, like our other cities and fire departments here in the county, become owners of the system. This means that we sit at the table and get a direct say in what would be the best deployment model in our city. If we determine another ambulance is needed, the system can add one. If our department wanted to upgrade our EMT level of care to a paramedic level of care, the system could help fund that opportunity. In October 2019, I stood before the board and urged many of you to vote in favor of an RFP after decades of zero ambulance competition in this county. I specifically asked that the RFP contain no language that would intentionally or inadvertently prohibit the fire service from participating in that process. Supervisor Williams echoed this sentiment. During the motion, he asked to review the final language so that it didn't exclude any public entities. It's now been over 2 years since that motion passed. And after hearing the presentation today, I fear that the RFP development process has strayed from those original sentiments. In fact, what I heard was a presentation that kind of pigeonholes us into the current provider. The board has several different options available to them in awarding or assigning an ambulance transport contract. It's not just limited to an RFP. Your local firefighters are here urging you to take whatever steps are necessary to ensure that the residents of our county receive the best and most appropriate service possible. Thank you.
We will now return to Zoom with Mr. Carlos Escobedo, who is our final speaker.
Hello.
Mr.
you
Escobedo,
hear me?
please proceed with your comments. Yes,
Oh,
we
yeah,
can
yeah.
hear you.
Thank you. Thank you, Madam Chair and members of the board. My name is Carlos Escobedo, and I serve as City Council member in the city of Santa Maria. Efficiency is necessary for a government to better serve our communities, and our ambulance system is not the exception. We have highly skilled and capable fire departments in our county. Example of this is in 2021, the Santa Maria Fire Department received over 10,000 phone calls for service, and most of those were not related to fire. And therefore, I would like to express my support for fire departments to be considered to provide the ground ambulance services. Thank you. Have a great day.
Thank you, Councilmember Escobedo.
And that was our final speaker.
Okay, so with that, we close public comment, and we have two issues now before the board. The date of the continuance and then the duration of the AMR extension. So this will test whether we're consistent with our values, what we've stated. We need a special meeting. We have Friday, May 27th at 1, Tuesday, May 31st, Wednesday, June 8th, Thursday, June 9th, or Friday, June 10th. Yes, thank you.
And Chair Hartman, members of the board, just with an update, Friday, May 27th is no longer a good day for some of the board members, as well as Wednesday, June 8th. It sounds like there is some SB CAG sub-regionals, so some of the board will be unavailable throughout the day. So the best day that we are looking at is Tuesday, May 31st. We don't have a board meeting that day since it's the day after Memorial Day, but it does look like the best day for most of the board at this time. I haven't heard back from all board staff. And then as Chair Hartman noted, Thursday, June 9th and Friday, June 10th are additional options.
Supervisor Lavenino.
I'm good, 5:31.
Yes, could we do, because some of us will be traveling and so if we could do it, say at 1 o'clock or noon?
And where do we want to do it?
Noon is good.
Sounds good.
Okay. So Tuesday, May 31st at noon. Is Santa Barbara all right? I think that's easiest for staff.
Yes, and Chair Hartman, just as a friendly reminder, we can always have the remote option here, and we can always have the remote option here in Santa Maria as well for any board members.
Okay, so Supervisor Nelson, did you have anything to add?
Yeah, that's just, I'm just concerned because that now makes it 3 weeks, not 2 weeks. I mean, we need to get this time frame pretty tight here to move this thing forward. So that's my only concern. Otherwise, I'll do whatever I can to be there.
Okay, well, at least we haven't pushed it out to June. And Supervisor Hart?
Yes, that works for me.
Okay, so Tuesday, May 31st at noon in Santa Barbara. And then to Supervisor Nelson's issue, the duration of the AMR extension. And Supervisor Hart, did you want to speak to that?
Yeah, I think that staff, my understanding was staff was trying to negotiate a 10-month extension and that they were very close last week and that there was some flexibility about that, a couple of months at the discretion of the director. I mean, that I think that lines up with what we talked about earlier. But you know, that I think it's subject to negotiation. And the point being, it just would be better for everybody involved to have a little more certainty over the next course of the next year as we go through this process.
And if I could add, I would rather keep it short and keep the pressure on us to keep moving rather than to spread it out. And so So I see some nods here. So is that 10-month or 12-month? Could you make the motion?
I guess I'll just make the motion to have direct staff to work with AMR to draft a contract extension, or actually conclude and sign a contract extension of 10 months with discretion for the executive director to extend that by a couple months if at her discretion.
And may I get a second?
I'll second that.
And now discussion.
Yeah, sorry.
Supervisor Nelson.
Yeah, thank you, Chair Hartman. I'm just concerned we're missing today an opportunity to put some issues on the table. Whatever we come up with in 3 weeks from today, we're going to have staff have to go back and look at some things and try to bring it, adjust the RFP to meet the needs of this board. And so, to me, by us not putting some of our issues on the table today, that's 3 weeks longer. I mean, this is one of the few opportunities we get a chance to talk to each other about this RFP, and I don't want to miss that. I mean, I'm glad for that. I think we're moving in the right direction as a team, but I also want to make sure that we're not losing an opportunity to discuss some things that we think are challenges, so staff can hear that and maybe start to look at the RFP and go, okay, well, maybe we need to be looking at response time. Maybe we need to look at employee retention, or all these other issues have been brought up from various parties. So that's my only thought. I won't go there unless everybody else wants to go there, but that's one of my concerns about us just kicking this 3 weeks later without further discussion.
Supervisor Hart and then Supervisor Williams.
Yeah, I just think that the sequencing is important. Sequencing of this is important. And I think that, my view is let's finish this part of it and then we'll move on to the next part of it.
Supervisor Williams.
I agree. I mean, I do want to, though, also not forget the other point that you brought up about that I frankly was also worried about, is this idea that we would take 6 months to redo the RFP with whatever changes that we ask for in 3 weeks. I think that that's far too long. I'm sure we will want to have some changes, but I think we need to be ready for a faster process than that, and staff prepared for the work that it will take to turn that around fairly rapidly. I mean, I think what's at stake is we don't know whether we would get an initial extension or not. We don't know whether how long the state will take to look at it. And so we cannot afford to elongate our process too long.
Dr. Del Reynoso.
Supervisor Williams to the chair. Absolutely 6 months. I'd like to get this wrapped up sooner than later, but our staff will respond to your board's direction, and we will be working fast and furious to send something up to the state. That's the big unknown, right? Nick, I believe that it took 2.5 months for them to review our draft.
That's correct.
And I think we used our hurry up, we need it fast card. And so I just don't know that whether it's going to take another 3 months or 4 months, but I'm just anticipating it to be the back and forth, as our county council explained, will take up to 6 months.
Supervisor Williams, did you have anything else you wanted to add? Supervisor Hart, would you like to make the motion? Oh, sorry. And Supervisor Williams seconded that. Okay, and that was County Council.
And Madam Chair, members of the board. So what I'm understanding is today that you're authorizing the staff to negotiate the extension. And then my recommendation is that we just also add that you'll continue the other 2 items, the consideration of the policy and the RFP, to that special meeting.
Yeah, I guess I'll just add the special meeting to the motion because the other parts were there, right?
Yeah, discussion of the RFP and the policies at that meeting. So yes. And that's okay with your second, Supervisor Williams? Okay, roll call vote.
Supervisor Williams,
Aye.
Supervisor Hart,
Aye.
Supervisor Nelson,
Aye.
Supervisor Lavenino,
Aye.
Chair Hartman.
Aye.
Motion passes unanimously.
Okay. That brings us then to departmental item number 5.
Chair Hartman and members of the board, departmental item number 5 is from Social Services Department. It is a hearing to consider recommendations regarding the Child Welfare Services Family First Prevention Services Act overview.
Welcome, Ms. Kruger. I think Mr. Nielsen previewed this during budget discussion, so we've been looking forward to your presentation.
Yes, thank you so much. Good afternoon, Chair Hartman and board members. I am going to be providing an overview of the Family First Prevention Services Act today, as long as some other associated prevention and child welfare services data. So starting off with the vision for prevention services in California today, back in 2018, county child welfare agencies created the Child and Family Enrichment Cabinet in partnership with the California Department of Social Services, with a goal to increase the visibility and urgency of a continuum of prevention services and supports throughout California counties. The cabinet is comprised of leadership from the Office of Child Abuse Prevention, as well as 10 county child welfare directors, and I am privileged to be one of those 10. Through this collaborative effort, the cabinet has been committed to steadily and equitably shifting the focus of the protection of children and youth who have been harmed through abuse and neglect to the strengthening of families with a reimagined child and family well-being continuum. And this has been established in order to support the prevention of child maltreatment and to create a vision of an integrated statewide system that supports families to provide safe, stable, nurturing relationships and environments for their children and youth. Further, this vision is supported by a system of care and a framework for prevention that includes both primary, secondary, and tertiary strategies grounded in the principles of fairness and equity. In order to achieve this vision, we're going to be focusing on uplifting the voices of children, youth, and families in all aspects of practice and implementation. Sorry. Excuse me. Promoting racial equity by specifically seeking to reduce disproportionality in the foster care system and supporting development of culturally responsive services and programs. Establishing an inclusive and participatory process for consultation and collaboration with tribes, supporting families with services, practices, and policies that are both strength-based and trauma-informed, empowering our community leadership to assist families and to support community efforts in developing needed services, striving for workforce excellence with staff composition that reflects the cultural aspects of the community and incorporates individuals with lived experience, integrating and collaborating across systems to maximize and leverage funding, share information and data, and provide families with services and supports to meet their specific needs. And then finally, focusing on program monitoring, integrity, and continuous quality improvement. The initiatives on this slide represent our department's current efforts in cross-system work, and we hope to build upon all of these efforts in order to implement FFPSA, as it will complement our existing capacity to further safety and permanency of children and youth who are brought to the attention of child welfare. The prevention of child maltreatment and its recurrence, however, cannot only be the responsibility of child welfare services, and we're hoping to create a system of care for children, youth, and families that will be addressed by many public and private systems, including child welfare, behavioral health, probation, public health, first five, education, childcare, and all of our community-based organizations. Cross-system collaboration and coordination is critical in order for us to successfully launch FFPSA. So turning to the statute itself, the federal statute was enacted in 2018, and Part 1 specifically speaks to prevention services. The intent is to increase availability and early access to quality prevention services for children, parents, and caregivers, and help children remain at home while simultaneously reducing the use of congregate care. Family First is not an infusion of new federal funding, however. Its goal is to redirect the savings by the reduction of congregate care placements back into funding for prevention services. FFPSA allows states the option to access Title IV federal financial participation for the provision of specified evidence-based mental health, substance abuse, and in-home parent skill-based services to children who are at imminent risk of entry of foster care, as well as their caregivers. It also provides services for pregnant and parenting youth in foster care and caregivers of children who are not currently placed in foster care and who qualify for services. The deadline for states to opt in to FFPSA was October of 2021. And in July of 2021, California's program was established as an opt-in for counties and tribes pending completion of the state's 5-year prevention plan. Implementation of FFPSA will further California's efforts to transform from a child protection and foster care system to a child well-being system. The program is a shift in the current paradigm and changing a focus from reaction to prevention and early intervention with the goal of reducing incidences of abuse and neglect, decreasing entries to foster care, reducing disproportionality, addressing systemic and historical trauma, as well as promoting social determinants of health in order to improve the lives of children and families. So now I'd like to take a look at some of our local data that we hope to impact through FFPSA. And I would like to thank our operations manager, Mary Ann Reagan, and her team for coming up with this data. And I'm going to quote her, as she often says, before we look at data, that it's important to remember that all of these data points reflect a child who's experienced abuse and neglect. And so we always say that so that we can remember to keep them at the center of our efforts and remind ourselves why we're going to be entering into this important work. So on this slide here, we are looking at our child abuse and neglect referrals received at our hotline over the last several years. As you can see, in 2021, we saw the sharp decline in referrals as a result of the pandemic. However, as children have returned to school and began to have more contact with the mandated reporters, we are beginning to see referrals increase again. So for the first quarter of 2022, we're averaging approximately 540 referrals per month, and we are now on pace to exceed 6,400 referrals if we continue at that rate this year. And so we are going to be, looks like, returning to pre-pandemic, if not higher levels of referrals for abuse and neglect. Currently, many of the calls that we receive at our hotline can be addressed through programs and services designed to strengthen and support families. And ultimately, through prevention efforts, we're hoping to partner with community members and mandated reporters so that we're not just looking at ourselves as mandated reporters, but also as mandated supporters with shared responsibility for helping families connect to services and support, as opposed to entering into the child welfare system in order to receive those services. On this slide, we're looking at entries into out-of-home care. And despite fewer calls to our hotline in 2020, we did see more children entering care, again, due to the effects of the pandemic. This included a higher incidence of families struggling with substance abuse, mental health challenges, and family violence. Since 2021, we have begun to see a slight decrease in those numbers, and so we're hoping that that will continue. In terms of FFPSA impacts, children are defined as candidates for prevention if they are determined to be at imminent risk, but they are determined to be able to safely remain at home as long as prevention services are provided. And it's important to note while categories of children and families for prevention services can be identified, imminent risk of foster care can only be determined on a case-by-case basis, and thoughtful consideration for each child and family's unique circumstances, as long as an unbiased process and tool utilized to assist the risk. And I also want to really emphasize here at this point that although we do hope to see fewer entries into foster care through the provision of prevention services, safety is still our bottom line. It's absolutely paramount and it is non-negotiable. So sometimes there's a concern about, the pendulum swinging one way or another. And so we're very mindful of making sure that we're utilizing these services whenever it's safe, but we're also making sure that children safety is first and foremost. And this slide reflects the average number of children in care on a monthly basis. Again, as you can see, that number began to go up in 2020 due to the increase in children entering care. And also we had an extension for young adults reaching the age of 21 to stay in foster care during the pandemic. So we had more entries and we had fewer young adults leaving the system, which resulted in that increased number. That temporary exception for those youth ended in December of 2021. So we've had more exiting and slightly fewer entries now. And now we are currently, as of March, back down to 422 youth currently in care. Again, we're hoping to see the overall number decrease as we begin to have more prevention services delivered and hopefully fewer entries. On this slide, we see the ethnicities of children in care as of July 1, 21. As you can see, the majority of children in care are Latino or Latinx at 74%, followed by white children at 21%. We have consistently small populations of African American, Native American or Indigenous, and Asian American Pacific Islander children in care. And if we drill down a little bit further to look at the path through the child welfare system and at different points by ethnicity, we have this data that's provided by California Child Welfare Indicators Project at UC Berkeley. And what we see consistently is that Black, Latinx, and Native American children and youth are disproportionately more likely to be receive allegations of abuse and neglect, to be child welfare system involved, and to be entering into foster care. And we have other factors, including poverty, economic inequities, structural racism, and structural racism, which all contribute to these disproportionalities and disparities at different points through the system. This trend is a little less pronounced in Santa Barbara County than it is overall in the state. Again, we have the small populations in many cases that we saw on the previous slide. And again, we're hoping to impact some of these disproportionalities and disparities by utilizing FSPSA and the development of community-based culturally responsive services and programs, and incorporating outcome measures to make sure that these services are delivered in an equitable way. So now that we have seen the vision and some of our local data, we'll look at next steps for implementation at the state and local level. California has submitted its draft to the Association of Children and Families, and it's currently in a back and forth review process. The plan is California's commitment to opt into the prevention program established by FFPSA, and describes how over the next 5 years, we plan to leverage the Act's benefits to accelerate the vision of comprehensive prevention services, and describes how California will meet the federal statutory requirements required through the 4E program. When we look at eligibility for the services in the program, the services are a valuable opportunity to look at a new way to serve children, youth, parents, and caregivers, as well as pregnant and parenting foster youth, and by promoting access to services and programs, and again, preventing entry to foster care. For the first time, we will be able to draw down 4E funding to provide prevention services to our children and families that are currently in open family maintenance cases, either on a voluntary basis or on a court-ordered basis. Other potential categories of children that may be eligible for these services include probation youth, homeless or runaway youth, children whose guardianship or adoption is at risk of disruption, Indian children identified by the tribes to be at imminent risk, children with substantiated or inconclusive investigation outcomes, as well as substance-exposed newborns or children whose parents are experiencing substance abuse disorders. Children and youth assessed for candidacy, again, will be reviewed in terms of the risk factors as well as the current family circumstances. And all that information will be utilized to determine what their needs are and what the best programming is to meet those needs. Again, we have a focus on equity, inclusion, and preventing disproportionality. Interventions and strategies will be inclusive, culturally appropriate, and responsive, and tailored to meet the needs of local children and families that are disproportionately represented in the child welfare system. The plan has been created to reflect an ongoing commitment to increasing equitable approaches to child and family well-being and to address disparities that impact BIPOC families. An equity and inclusion lens will be utilized at every phase of planning, design, and implementation as part of our broader prevention efforts. In order to provide trauma-informed and culturally responsive services and support, we will utilize the core practice model to ensure authentic engagement with family, tribal, and community networks and the use of culturally based practice adaptations. A community pathway is critical in order for families to access services prior to a call ever being made to our child abuse hotline. The equity-centered approach keeps them from having to become child welfare system involved in order to access the services and supports that they need. So we will now have two pathways to prevention services through FFPSA. We will have the traditional child welfare pathway for Title IV prevention services, which will allow our local child welfare agency to interface with children and families and assess, identify, and support them as we do now, and provide prevention services directly, again, through our voluntary and court-ordered family maintenance programs. And now we will have a new secondary community-based pathway, which will allow struggling families residing in local neighborhoods who often voluntarily seek support from public and private agencies. And we will be able to engage and strengthen connections between those organizations and work with our local service providers that understand the needs of particular communities to provide direct services, such as our CBOs and our family resource centers. And we know that this partnership is really the key to the ultimate vision for upstream prevention efforts by working with our community partners. Our agency still will retain oversight and will be responsible for making the initial candidacy determination. Evidence-based programming and services are required under FFPSA. Multiple criteria were utilized to select the evidence-based programs, or EBPs, to include in the state's prevention plan. This includes those that are already implemented successfully in California, the qualifications of the practitioners that would be required to deliver these services, as well as the target populations and their effectiveness at serving BIPOC children and families. After reviewing all of this information, the state did select 10 evidence-based practices, and at the local level, counties have flexibility to determine from the 10 on that list which ones are the most appropriate to serve the needs of the particular children and youth and families in our communities. Unfortunately, of those 10, we have 4 or 5 that currently exist in our county already being delivered. And so we're pleased that we'll be able to build on the success of those and work with our local providers to ensure that they are in alignment with the standards and meet all aspects of the evidence-based program requirements, but we have a very solid foundation on which to build from there. And the last pieces, which are yet to be developed, will include development of a coordinated approach to continuous quality improvement, protocols for regular assessment of outcomes, effectiveness of services, and looking at lessons learned to continue to refine our practices, It'll also include development of a government structure to oversee and guide implementation of high quality evidence-based programs. And in terms of training, we have in California our regional training academies that provide training and professional education for child welfare throughout the state. And prevention services and coordination will become part of the statewide curriculum. And the current structures in place will be utilized to develop and deliver a curriculum to implement FFPSA for all counties. So finally, local implementation and our next steps. So in accordance with the statute, counties have been provided the option to participate in the program to supplement the state's efforts to build an evidence-based prevention programming through AB 153. California has also provided counties an additional $199 million through a state-funded block grant program to support implementation efforts to develop a full continuum of prevention services. And state block grants can be used for planning, capacity building, implementation, and also building out the primary, secondary, and tertiary levels of a prevention services system. Our county did receive an allocation of approximately $2 million, one-time funding that's available for our use through 23-24 in order to prepare for development and submission of our local comprehensive prevention plan. And we did submit a letter of intent last month in order to be able to start accessing those funds. And locally, we're leveraging several existing groups for input and feedback on our FFPSA plan. Our primary responsibility for the development lies with our cross-sector prevention team. This team is led by DSS and includes members of child welfare, probation, behavioral wellness, public health, First 5, Child Abuse Prevention Council, network of family resource centers, county education, as well as other community-based organizations. We've been focusing primarily on prevention, as well as themes of adverse childhood experiences, resilience, equity, inclusion, and trauma-informed care to date. Our next step is for our prevention team to attend the virtual statewide convening that's coming up in June, and we're going to be focusing on readiness and capacity assessments, as well as continued receiving technical assistance and continued implementation planning in preparation for the development of our local comprehensive prevention plan, which will be due in January of 2023. So in closing, I just want to acknowledge that this is going to be a very heavy lift for state and counties. It's a huge effort, but we're really excited for the first time to be able to begin to look at this paradigm shift from the child protection to the child and family well-being system, and for shared responsibility with all of our partners to really look at how we support children and families across the spectrum and for the benefit of all of our community. So with that, that concludes my presentation, and I'm happy to answer any questions you have.
Supervisor Hart.
Well, I just want to thank Ms. Kruger for what is a sobering, but also ultimately optimistic presentation about what we're trying to do. You know, your point about the effects of the pandemic, you know, drug and alcohol abuse going up, mental health challenges and the trauma that comes from that, and unfortunately, you know, family violence that affects children is this is a really good reminder about how important the work you do is. And what I'm really optimistic and hopeful about is, you know, the focus on evidence-based work and the fact that you are going to do continuous improvement and evaluation, and really including the staff, you know, through workforce development to make the system work as it's the best way it possibly can. And I really appreciate the focus on addressing the inequities facing BIPOC youth. That's really important in this moment. And the evidence that we have is that there are disparities that need to be addressed. So I think the department's doing a great job. Thank you.
Supervisor Williams.
Can you re-show the slide? I just want to make sure that I remember and it sinks in who are eligible for the prevention services. I think that's really important because we all communicate with a lot of people. Not all of them disclose that they might be in a place of life where these kinds of services are necessary, but I think it's something that we should probably talk about as we are both ambassadors representatives of the community, but also ambassadors to the community. And we never know who we might be able to help by increasing public knowledge about it.
I don't know if somebody can help bring that back up because the slide itself, but I can.
Yeah, maybe the
in terms of
chair can move
cat-
on to somebody else while we get that slide back up. That's fine.
Sure. I don't see other lights, but
Oh, okay.
I had a question.
It is 18. Oh, okay, they'll bring it up. Okay.
Is that the chart, Supervisor
Is this what-
Williams?
Is this what you're referring to here?
That and any, so
So the category,
these would be all be eligible for preventative services.
yes. So any candidates for foster care. So children who are at imminent risk of entering foster care and their caregivers are eligible to prevention services as long as they're determined to be able to remain safely in the home with the provision of these services. And so the primary category is going to be children who basically are already involved in the child welfare system and either in voluntary or court-ordered family maintenance cases. But there are other targeted populations who have been identified as likely eligible, and that includes probation, homeless, runaway youth, children whose guardianship or adoptions are at risk of disrupting, Indian children who have been identified by tribes to be at imminent risk, children who have had investigations that are substantiated or inconclusive, and substance exposed newborns, as well as children whose parents have been identified as experiencing substance abuse orders, and children exposed to domestic violence. So a pretty wide variety. It's not all inclusive, but those are some of the major categories that have been identified.
So even if there is not an other known risk factor, any child whose guardianship or parentage is in transition may be eligible.
May be eligible, absolutely, yes. And that's where it'll come down to having to do the individual assessments of the child and family circumstances and
Yeah, and obviously
history and-
all of these are because a large proportion of folks in that category end up
Yes,
otherwise needing the services on the back end, which
Yes.
is harder.
absolutely.
I had a question about the programs. You said that the state has basically certified 10 programs as being evidence-based. And in our county, we have 4 or 5 that align with that. Could you describe the programs in more detail or just give me a better sense of them? And then my question is, are those programs that CBOs offer, and would we be assisting those CBOs to get them the kinds of qualifications that would be needed? So that's the arena of my questions. You can respond.
Thank you, Chair Hartman. Yes, there are 10 evidence-based programs that have been identified at the federal clearinghouse as eligible. And there are other clearinghouses that California has its own clearinghouse that have many more programs, but these are the specific 10 that they've identified at the federal level as being eligible for Family First. And so, for example, we have in our county parent-child interaction therapy that is offered through CBOs, and I believe probably through our behavioral wellness department as well. We have.
So does someone take a course and then get that? Okay.
Yes, and that's kind of where the heavy lift comes in. Many of these evidence-based practices require certification that involves, sometimes there are sole providers in other states, that provide the training and certification for these programs. And that is the challenge with implementing evidence-based programming because it's expensive. It's the fidelity to the model is important. They're very rigorous. They require constant, monitoring. And again, sometimes certification and observation by the provider in order to continue to be certified to provide those services. We do have some programming that is a loosely based model, based on the practice, but maybe not certified because of the cost. And as we all know, with staff retention now, it's a big investment to get somebody certified in these programs. And then when people go to have to continue to recertify people, it can be a real challenge for our local CBOs. And so, yes, some of those, the block grant funds are specifically intended to help us get our local providers up to speed and certified with the EBPs to help offset some of those challenges for them.
Thank you. Any other questions? Supervisor Nelson.
Yes, thank you, Chair Hartman. Can I get to that slide where it had the different statistics of allegations per demographic?
Bring it up or
oh.
Here. Go. Yeah. Oh, it's there. It's okay.
So I understand that we're looking at this as inequitable, right? And so what are we not doing? What are the strategies to fill that? Because I mean, is the goal for the population to equal the allegations by percentage, or what does that look like? Because that's something I always kind of struggle about. I instinctively think the allegations are generated by the need, and so not based on some type of racial profiling or whatnot. And so I'm just trying to get my brain wrapped around that. So can you help me?
Thank you, Supervisor Nelson. It's a very complex issue with a lot of inputs. This is something that has long existed in child welfare, and there have been a lot of attempts, a lot of initiatives to try and get at different things. It's fairly consistent, again, across the state and most counties to see overrepresentation of Black, Latinx, Native American children in care. It's pretty consistent to see an underrepresentation of white and Asian American Pacific Islander children in care. Again, we have some very small numbers in some of these groups in our county. When we're talking about 5 children, Native American children. And so sometimes that might be 1 or 2 families.
Right.
And so there, it gets really difficult with these very small numbers to try and tease out, what we can do to change that. Sometimes that's it. Sometimes it's absolutely appropriate, like you said, based on the need. But what we try and do is to look at these situations and see, is there something here that we could be doing differently to change this? I think you probably recall the effort a few years ago through the racial and ethnic disparities group that probation led,
right,
where we looked as systems through probation and mental health and education and child welfare, where we did try and really look at some of these numbers. And there's a lot of factors, again, when we go back to inequity and poverty and systemic racism, and we see, all of those things impact what drives these numbers in terms of who's making allegations, what's happening, investigation outcomes, what's happening with substantiation, and ultimately who ends up entering foster care. So there's at each point of the way, there's these decisions being made and all of those factors combining. And it's an ongoing process to be looking at what can we be doing differently to change this, which is really what the goal of this is to try and start unpacking some of that and seeing what we can do to move the needle.
I would think it'd be interesting to look at some of these numbers. I think socioeconomics is probably one of the biggest correlators, right? And
Absolutely.
that can reach beyond, racial numbers. So, I think that's something we should be looking at, and obviously
Yes.
that is a part. Are there still things that we're doing in our organization that we could be working on the systemic racism side? Is there something that that we need to implement? Are there policies that we're failing to engage in that is make this problem worse?
I believe there's always something more we can be doing to be looking at that. We have a number of things that we're working on. We're working through our core practice model to look at more training for staff in terms of looking at all of these issues, becoming, implicit bias, looking at the historical issues in the child welfare system. We are doing our county self-assessment currently and looking at some of these issues to see, getting feedback from focus groups, community partners on what else we can be doing in order to have more equity in our system, and looking at strategies like parent partners to be and cultural brokers to help with some of these issues, and also in alignment with implementing some of these evidence-based programs that have been shown to be specifically effective with different populations. And then just working again with all of our partners, again, in our systems, in our kids network systems, to be looking at the issues of equity and, as a community and as a network of providers, what can we all be doing together to keep raising and elevating these issues and doing better?
One last question. I know we've looked at the courts and seen outcomes are different north and south in the county, right? With some of the sentencing of some of our youth, for example. Are we seeing anything different in some of these numbers based on North County or South County? Or is there anything that's measurable that you guys are noticing that any inequities there?
Currently we actually have all of our cases being heard by the same judge.
Okay.
Since the pandemic, we've shifted from the north-south just to the one North County, since it's virtual primarily now. That's not something that we've necessarily looked at before, is to do an analysis by court. But that's an interesting question.
Yeah,
Yes.
just
Yeah.
curious.
Yeah.
Thank you.
No.
Okay, well, I don't see any more lights on. Is there any public comment on this item, Madam Clerk?
Chair Hartman and members of the board, we have no request to speak on this item.
Okay, and that brings it back to the board and ready for a motion on get the right board letter in front of me here. A and B in today's board letter.
I'll make a motion that we vote to approve A and B, that just receive and file.
And Supervisor Williams.
Second.
All in favor say aye.
Aye.
Any opposed? And thank you for a great presentation. It's really exciting to, as you say, go upstream and really think systematically about where we can make interventions to change the system. So thank you.
Absolutely. Thank you for the opportunity.
County Council, what are we going to hear in closed session today?
Thank you, Madam Chair, members of the board. You have two items for closed session. The first is public employee performance evaluation under Government Code Section 54957. The public performance evaluation is of County Council. And the second is a conference with existing litigation, Government Code Section 54956.9, Christopher Anderson versus County of Santa Barbara, Superior Court Case Number Z2CV01299. And the time estimate is about an hour and 15 minutes.
So we'll be back about 2 o'clock. All right. Thank you. Good afternoon. We're reconvening the May 10th, 2022 Santa Barbara County Board of Supervisors meeting, and we just came in from closed session. County Council, would you report out, please?
Thank you, Madam Chair, members of the board. The board met in closed session on two items, public employee performance evaluation for county council and conferences of existing litigation on Christopher Anderson versus County of Santa Barbara, case number 22CV01299. This is a case that raises CEQA challenges to the county's plan to remove encroachments and restore the right-of-way on portions of East Mountain Drive. In closed session, the board authorized county council to seek appellate review of the court's issuance of a preliminary injunction against the county. The board also authorized county council to file a cross complaint in the pending litigation, the details of which will be disclosed once the action is formally commenced to any person upon inquiry. The vote on the board was unanimous with all supervisors being present.
Thank you, Ms. Van Mullum. And Madam Clerk, would you read item 6 into the record, please?
Chair Hartman and members of the board, departmental item number 6 is from the Planning and Development Department. It is a hearing to consider recommendations regarding SB Clark LLC residential subdivision, Key Site 3, General Plan Amendment, 13 GPA 5, rezone 13 RZN 1, vesting tentative track map 13 TRM 1, development plan 13 DVP 10, road naming 17 RDN 5.
Thank you. And have any board members had any ex parte communications they would like to share? Supervisor Nelson?
Yes, thank you, Chair Hartman. Had a meeting with Mr. Manzi on, I think some of these might be repeated from last time, but March 30th, 2021, where I had a site visit, phone conversation on 9/9/21, and then another conversation on April 13th, 2022. I've also discussed this with planning staff at my monthly meetings, and I had a specific meeting with planning staff on 10/11/21. So it's
Supervisor Lavenino.
Thank you, Madam Chair. I met with Mr. Matt Manzi, September 13th of 2021 for a site visit. I had phone conferences on April 7th and April 18th.
And Supervisor Hart?
Yes, I had a meeting in person with Mr. Manzi last week. I cannot precisely get my hands on the day, but we talked about his efforts to secure secondary access to the project. And what else did we talk about? I think that was the main thrust of our conversation.
Thank you. And I reported my earlier ex parte at the previous meeting, so I don't have those this time, but I did speak with Mr. Manzi on April 25th by Zoom.
Madam Chair.
Supervisor Williams.
I met with Mr. Manzi via Zoom on the 5th, and we discussed their efforts to secure the secondary, the other entrance to the project. And we discussed the relationship to the previous project, previous approved project, and density of both projects.
Okay, with that, Director Plowman.
Madam Chair, just for the record,
sorry.
my meeting with Mr. Manzi was on April 28th.
Now, Director Plowman.
Madam Chair, members of the board, thank you. So as indicated, the board heard this item previously in October 2021 and had asked the applicant to work to attempt to obtain access via another route so that the general plan amendment would not have to be moved forward. And they have done that, made an attempt at least. And so today we've come back based on the request from the applicant to return to the board and have a discussion about what it is that entailed over the last several months and then seek a decision from the board. So with that, I've got Shannon Reese, who's been the planner on this project here today, and then Travis Seawards, the deputy director of the division, is available via Zoom. I'll turn that over to Shannon for the presentation.
Thank you, Ms. Plowman.
Hello, Chair Hartman, members of the board. I'm here today to give a quick refresher on the project, go over the Planning Commission's recommendations on that project for denial, and to talk briefly about what has occurred since the October 12th hearing. So just to reorient everyone, the project site's designated as Key Site 3 in the Orchid Community Plan, and it's located on the west side of Highway 101, approximately a quarter mile south of Clark Avenue. The site is bounded by the 101 to the east, Sunny Hills Mobile Home Park to the north, residential lots larger than an acre to the west, and the undeveloped Solomon Hills to the south. And back in October, we spent quite a bit of time going over the history on this site, including what the Orchid Community Plan and associated EIR had anticipated here, the MRO zoning for 20 units per acre that was applied to the center of the mesa, which is shown in orange here, back in 2009, and the project that was denied on this site back in 2012 for 125 larger lot single-family dwellings. We also covered the ministerial by right path for housing in the MRO zone on site. So I won't go too much into those items today unless there are specific questions. Instead, I'll be giving an overview of what's proposed by the applicant now. So the proposed 119 single-family dwellings would be confined to the Mesa area to ensure the preservation of open space on the site, and the reduced project footprint also results in reduced environmental impacts as compared to the projects that were analyzed in the OCP EIR and the project that was denied in 2012. And that reduced project footprint is accomplished by clustering the homes. The lot sizes on the site for homes range from approximately 3,000 to 13,000 gross square feet, with an average lot size of 4,140 square feet. And the larger lots and single-story homes are adjacent to the existing residential development, while the two-story homes are stepped into the interior of the site. Project also includes dedication of 91 acres of public open space to the county, and the applicant also would retain 22.5 acres of private open space on site. There were a number of questions in the prior hearing, particularly from Supervisor Williams, about the density of the development, which it's a little tricky to address because the primary intent of this zoning designation is to encourage the clustering of structures and preserve open space to the maximum extent feasible. But because of that, there's no minimum lot size or maximum density is established for the zone. So if you look at the land that's retained by the developer, counting the roads and the private open space and such, which is how you would look at it if it were design residential zoning that also emphasizes the preservation of open space, the density would be about 3.5 units per acre. Whereas if you were just counting the single family dwelling lots, it's about 10.5 units per acre. And that's comparable to the density that's established for small lot plan development, which has a minimum lot size of 4,000 square feet. And there's zoning like that on Tuscan Way, about 700 feet from the western edge of Key Site 3. There are also comparably sized lots, both in Jensen's Crossing and portions of the Rice Ranch neighborhood nearby. The proposed project also includes a rezone from RR10 to PRD 119. It's planned residential development, 119 single-family dwellings, and a general plan amendment. And those are described in detail in the staff report. But essentially, the changes to the general plan reflect updating the land use and zoning designations that result from the rezone, the proposed secondary access update, and minor trail realignment. And the Planning Commission heard the project back in November 2020, April 2021, and last on May 2021. In that last hearing, they recommended that the board deny the project based on inability to make findings pertaining to community welfare, appropriateness of the population density in the proposed PRD zoned area of the site, and the compatibility of the project with surrounding items. And the board considered those items on October 12th last year and continued the item as Ms. Palman indicated. The applicant was able to reach out to all 13 property owners whose land together composes Oakbrook Lane. They were able to speak directly to 7 of them, none of which were supportive of granting an access easement, and 2 additional property owners that they reached out to signed a petition in opposition of granting that easement, which was attached to the board letter. There were 4 property owners that have not responded or signed the petition. So for that reason, the project is returning to the board at the request of the applicant to obtain a decision on the project as is. And secondary access remains over the existing 80-foot wide non-exclusive easement over Chancellor Street for ingress, egress, and public road purposes. So to follow the recommendations of the Planning Commission, your board should make the required findings for denial of the project, determine that the denial of the project is exempt from CEQA, and take action to deny the project. And that completes my presentation. Staff is available for questions. From the applicant team, we have Mr. Matt Mancy, as well as Mr. Patrick Kaufman, the civil engineer attending via Zoom, Mr. Dennis Lammers, the traffic engineer attending via Zoom, and the applicant's representation, Mr. Mark Mannion and Mr. Cameron Goodman. I believe we also have Jeff Lindgren, or Mr. Jeff Lindgren and Mr. George Amoon from County Parks, and Mr. Will Robertson from Public Works Transportation Division available for questions.
Thank you. Supervisor Lavenino? Okay. Supervisor Nelson?
Yes, thank you, Chair Hartman. Just a quick question about the project itself. Trailhead parking, because there's a trailhead here that would be accessing the Solomon Hills. How many spots are on that?
Madam Chair, Supervisor Nelson, Ms. Reese needs to look that up. So
No problem. I
take
can
a
take that a
second.
little later.
Yeah.
That's fine.
And I had a question for Mr. Lindgren. If this were to be approved, can County Parks handle the 91 acres of the new open space?
Chair Hartman. This is George Amoon from County Parks, stepping in for Jeff Lindgren. And yes, it could, because it'll be left in open space. It won't really need maintenance. There'll be trails along there. So it's not like a park that'll need maintaining, like mowing, things like that. It's just to be left in natural open space, so it wouldn't take really that much maintenance.
Thank you. And the trail network, did that require any maintenance or construction?
Yes, a little bit. Some construction will be done by the applicant. And they're on the hook for 2 years after that. And then that point forward, they'll be maintained by county parks. But again, they'll be mostly dirt trails throughout the open space. And so just periodically, they'll be need some maintenance, but not much at all.
Thank you. Seeing no more questions from the board of staff, Mr. Mancy? You've been through this before, 10 minutes, however you want to spend it.
Thank you. Good afternoon. Good to be here in person. Thanks for seeing us again. Very happy to be back here. When we last met, I was given direction by the board to talk to the neighbors, and I'm kind of rehashing what Ms. Reese already said, and I'll try to go fast because she covered a lot of what I was going to cover. But we were also sent to explore a sound wall as well along Sunny Hills, and we're definitely willing to do that. Is my presentation up? Oh, great. So I'm just going to skip ahead a little bit, not to be repetitive. This is the context of our project, which you have already seen. This is the site planning with the upper mesa in mustard yellow. And that's kind of where we're proposing to put all those cluster homes. This is the open space dedication. It's a breakdown basically of what we're proposing to build on, which is 20% of the total 138 acres. 15% of that would be private open space, with the rest, which is 65%, being dedicated to parks and trails. Here's a site plan of the trails and how they connect to the Solomon Hills Trail to the south. Ms. Reese mentioned that staff had recommended approval prior to our Planning Commission hearing. The Planning Commission decided to deny the project, citing some reasons, and some of them were based on the fit. They didn't believe the fit of the project was consistent with the neighborhood nearby. So we're proposing to provide an opportunity to benefit the county in many ways. To name a few: tax revenue, road realignment through Key Site 2, home ownership for renters and residents, and helping to alleviate jobs and housing imbalance in the county. In lieu of fees for affordable housing and the open space that I previously mentioned. So we were asked to approach the homeowners at Oak Brook.
Excuse me, Chair. I think we're off by one slide on the presentation. So sorry if we could pause for a second. I think it was off. Oh, so he advanced it himself. Okay.
Yeah, sorry.
Yeah, if you go back
Am I
one
going
more,
too
Matt,
fast?
I think you're advancing one too far. There you go.
Sorry about that. So yeah, we were asked by the board to approach the Oak Brook neighbors. I was able to approach or send letters to all of them, basically reaching 7 of them. The unanimous sentiment was that they did not want secondary access going through their street. It should be noted that 4 of the homeowners did not return my calls, letters, or emails. Ms. Reese mentioned the petition. It came to my attention that that petition had been circulated against that idea shortly after the hearing on 10/12. Over the course of the discussions, the neighbors of Oak Brook generally like the project, but don't understand why the secondary access should go through their street. As far as that sound wall that I mentioned, that's something we're willing to do and work with the Sunny Hills Mobile Home Park if the board would like us to do that. We know about the California housing crisis, and there's an opportunity here for us to do something about that. People that work in Santa Maria and Orchid, even people that work for the county here, can't find homes to buy. There's not enough inventory. The few houses that are available at Rice Ranch are selling between $800,000 to $1 million, and the 119 homes we're proposing would sell for in the $600,000 to $700,000 range. And that's a mix of 1 and 2 story units. Good homes for starters and seniors as well. We don't believe the project is sprawl. It's pretty tightly concentrated on that 28 acres of the 138. We mentioned density, so I'm not going to touch on that just for time. The easement, we do have a viable easement through Chancellor, and Cameron, our counsel, is going to speak to that in a second. But Chancellor is 10 feet wider than Oak Brook. It's in better condition, and it would directly affect only 5 houses versus 14 on Oak Brook. And directly affect, basically, I'm talking about cars that are going to be passing those homes from our project. So this slide, this represents the 14 homes. As you can see, actually, sorry, that's the wrong slide. There we go. So these are the 14 homes on Oak Brook that would be directly affected by the secondary traffic going through there. And then these are the 5 homes that would be directly affected. And then this view shows the distance between Oak Brook and Chancellor. It's about 700 feet. It's not too, they're not too far from each other. So to summarize all this, again, Chancellor is 10 feet wider and in better condition. Having our secondary access through Chancellor only directly affects those 5 homes versus 14 on Oak Brook. The 2 roads are parallel to each other, separated by only 700 feet. So because of this, we feel that if given the choice, Chancellor is the best and least impactful road to have our secondary access go through. Also, when the Board of Supervisors approved the MRO back in 2009, they agreed with that assessment and approved it to go through Chancellor. So I'm going to ask Cameron to come up and speak to the easement that we have.
Good afternoon, Chair Hartman, members of the board. Thank you for your consideration of this project. I just want to address a couple legal issues, and I'm available to answer additional legal questions from board or staff. First, there's been a fair amount of discussion from the board about whether our clients have legal access rights via the easement on Chancellor Street. At the moment, there's no lawsuit or threats from the neighbors on Chancellor Street to block our clients' access to the project site. And even if a dispute with the neighbors on Chancellor resurfaces, that shouldn't really concern the board when considering the project for approval. So long as you agree with us that Chancellor is in fact the appropriate and preferable access, secondary access to the project site, that's all you need to understand for approval of the project. We will deal with any private dispute with the neighbors if that arises, and in the courts if necessary. It's really incumbent on our clients, not the county, to deal with any dispute over the scope of the easement. So we think that that issue should be settled at this point. And secondarily, as we addressed at the last hearing and in our comment letter, the Housing Accountability Act really compels the county to approve this project, and it prohibits denying the project or even conditioning it on reduction of density. The California Department of Housing and Community Development is actually monitoring the progress of this project, and HCD has enforcement authority with respect to the Housing Accountability Act. And even if HCD doesn't take action against the county, if the project is denied or conditioned on reduced density, that legal issue will eventually be resolved in the courts if the project is denied. The project is clearly consistent with all applicable standards and criteria as set forth in staff's original recommendations for approval to the Planning Commission, which were only turned on their head with contrived findings after the Planning Commission directed staff to come back with findings for denial in response to the complaints from a few neighbors. That's really what the Housing Accountability Act was designed to prohibit. And we believe the courts would agree with us in that regard. So, thank you again for your consideration, and I'm happy to answer any questions. I believe Matt has some closing comments.
Yeah, I'll be really brief. So just to summarize, county staff had recommended approval, and they did this because we comply in every way with the planning requirements as well as the OCP. We're only building on 28 acres of the 138, and this was the result of past Planning Commission and Board of Supervisor hearings, as well as just wanting to limit the impact of our development on the environment. The rest is being dedicated to open space and trails. Regarding water, we have a will serve letter from Golden State Water for 200 acre feet. And county staff as well as fire both agree that Chancellor is an acceptable secondary access road. So thank you so much for hearing me. We appreciate being here, and I'm here for any more questions.
Do board members have questions? Do we have any public comment?
Chair, I actually had a question.
Please.
Yeah, thank you. Thank you, Chair Hartman. Mr. Manzi, do you mind? I did get the list of the outreach that you guys did. Do you guys look at doing some engineering to see the cost comparison between Chancellor and Oak Brook?
We didn't do any engineering as far as what the cost would be to improve the road. So yeah, the answer is no, we did not.
Okay, did you guys do an appraisal for that easement?
An appraisal for?
To acquire the easement from the neighbors on Oak Brook.
I don't quite understand what the appraisal would accomplish.
Well, when you would go to get access from the neighbors, you probably have to give consideration. Did you guys figure out what that consideration would be?
We didn't offer any consideration. When I approached the neighbors, it was merely if they'd be willing to grant that. That's something that we could consider. If there was anybody that would be interested in granting us those easements, then we would consider compensation, but we didn't lead with that.
Okay, so you guys don't have any idea what that compensation would look like for, I mean, because you're asking for an easement, which is an acquisition of real property, right? And so, I mean, when you come into a negotiation with somebody, aren't you offering something? I mean, do you guys have any idea what that would look like?
No, the answer is no. I don't know what it would cost to acquire those easements. When I approached the neighbors, the ones that did talk to me were adamant they didn't want to give us one under any condition.
Okay.
And so that kind of squashes any negotiation when you hear that.
Is that in part because those neighbors were promised that this road would not go through their property in exchange for offering the sewer easement?
Yeah, it's possible that they were told that. Yes, we use agents to acquire those sewer easements, and a lot of them were under the impression that we would be going through Chancellor because that's the easement that we had.
Okay, thank you.
Thank you.
Madam Clerk, public comment.
Chair Hartman and members of the board, yes, we have 4 requests to speak on this item here in Santa Maria. We're going to begin with David Hassett, to be followed by Gary Crabtree. David?
Hi, I'm David from Sunny Hills. Been up here multiple times. Probably heard all the negative things all constantly over and over. Don't know the answer to is basically the easement of the road. I believe was granted because the zoning was for 10-acre ranchettes. So if you take 138 acres and say 14 homes, you're talking traffic zoning would have been way lower when the easements were granted for them for their property to begin with. And we're talking the one next to the freeway, and we're also talking Chancellor Road. So that's why they're getting so much feedback, is because this is way overdensed, way too much. When they're talking about these homes, they're not bringing up all the traffic from the MRO. And then when they talk about the MRO, they're not talking about the traffic for the home. So it's a complete 2 separate projects, but it's actually all in one. So it's way too big of a project, way too much traffic. And just how everything's going through right now, it's supposed to go through Key Site 2, it's supposed to put in a shopping center, a gas station, the fast food. Well, all those cars, including us at Sunny Hills, is going to be going through that shopping center to go to the light, because we can't make a left turn from our existing access easement that we have. So that means if that project gets built, all that traffic is going to be going through that shopping center also. We are a senior community, so we are worried about, safety and ambulance getting to our seniors and easy access. And so with that being said, I hope you guys deny the project and maybe do some research on the setback, because maybe they were told they had full access for this project for the MRO and this. But I can't see, just with the easements that they have was designed, it was originally for the 10-acre ranchette. So I could see the traffic for the small housing development originally, but I think you're going to get a lot of feedback from everybody because of the easement situation, the traffic problems. So thank you.
We will remain in Santa Maria for Gary Crabtree, to be followed by Catherine Sheehy. Gary?
Hello, my name is Gary Crabtree, and I'm here to speak in favor of this proposal. I'm here in favor of supporting the local planning and building seems to me are also in agreement to this proposal. I've lived in Orchid for over 60 years. I've raised my family, and I have lots of friends and relatives that all have children and grandchildren that would love to own a home, and specifically in that area. And being a real estate broker in the market for over 45 years in development and sales, there's such an extreme shortage, worse than I've ever seen in the 45 years that I've been in the business. And a project like this, and I don't get involved with the transportation and how all that's supposedly done by people who know what they're talking about, and that's not me. I'm just talking about, I'm representing 118 future families that need a home. And they come to me and my peers and ask us to try to find them a place to live. And I pulled up available housing between 550 and 750 before I came in here today in all of the Orchid areas, and there are 5 homes for sale. Every single home that comes on the market, there are multiple offers, and only one family gets a home. All the rest of them are out there trying to find a place to go. And so it seems to me like that there has to be some kind of a balance between the haves and the have-nots. And in the project that I lived in, prior to me getting there, the subdivision that was 15 years prior to that came in and did the same thing. We all think that everyone should have a home, but we want their home to be somewhere else. We don't want it to be where we are because of the noise, because of the traffic. And that's the way it is in every single subdivision that ever goes in, because there's always going to be a subdivision that was there prior to them. And that's the way they all feel. And so it's a human condition. I understand that. But being in the marketplace and selling a lot of homes to first-time home buyers, there is nothing that I can do for them or help them. And so it seems to me like anytime we can get a project that developers willing to come in today's marketplace and put up the kind of money that they have to do and take the chances with the kind of market that we have, my hats are off to them. And so I think that this project is great because it is much smaller in the size of the home and the lot. I think he touched on the fact that most of the properties that are for sale in our area up off of Stubblefield are all approaching $1 million. And these homes would be significantly $400,000 less. So all the people that I work with, especially in the younger set, they can afford a home in this price range. They can't afford one of those. And so I think that there needs to be something that is looked at when it comes to the affordability and making the decision on what's going to be in the best interest. Right now, there's a few head of cattle that occupy that 138 acres.
Thank you. And that is your time.
Okay, thank you.
I do want to thank him for his passion. I wish we had a few more people in the South County with that kind of passion for housing.
And we will now go to Catherine Sheehy to be followed by Bill Brown, who is our final speaker. Catherine.
Good afternoon. My name is Catherine Sheehy, and I live with my husband, Patrick Sheehy, at 1705 Chancellor Street. Our property is adjacent to the lower southwest portion of the proposed development. I'm here today to respectfully ask you to deny the proposed project. For close to 25 years, my husband and I, together with our neighbors, have vigorously opposed development above and beyond the current RR10 zoning for gateway, scenic issues, density, decreased quality of life in our small rural neighborhood, loss of riparian habitat, flora and fauna, including the disturbance of Orchid Creek to build a bridge, and most of all, for the traffic that would impact Chancellor neighbors. And not only that, but would affect Mesa Verde, Cobblestone, Jensen's Crossing, Cimarron, and further put pressure on those streets feeding into Stillwell Road and up onto Clark Avenue. As time has gone by and projects such as light commercial build out, such as Verizon, cottage urgent care, and home developments like Jensen's Crossing, few citizens in the area, to my knowledge, have ever opposed those. But Key Site 3 has been different. There's been no clear support in the community for the proposed project. Developers, planners, and commissioners alike have found the project problematic. Traffic flow especially has never been properly mitigated, nor has an acceptable plan been presented. Could the developer and county staff rethink the east side of the Key Site, which runs from the top of the mesa, connects to a frontage road to Clark, and runs down the mesa parallel to the freeway where the developer has proposed open space, thus staying out of Chancellor Street neighborhood, saving the creek, saving Oak Brook, taking the pressure off those lower Stillwell area. The plan as proposed today is too simplistic. It does not consider the eventual crushing increase in traffic and safety issues at total build out, which does include that MRO. Thank you very much.
We will now go to our final speaker, Bill Brown. Bill?
I am Bill Brown. I live off of Chancellor on Hamilton Lane. I'm one of the houses that this project is proposing to run right by. One of the slides that Mr. Mancy was using was a little outdated, and it just shows the fact that he never even comes into the community to actually see what he's actually affecting. If he would go by, he'd see that the Crabtrees have actually sold off 2 more parcels down lower on Chancellor, which would have, there's one already almost done construction. There's already another one that's actually getting built right now. I'm not sure if it's Mr. Crabtree or his son that lives on Oak Brook, but I find it very interesting that out of all these meetings, he's the only person who has supported this project. Not a single person has supported it, just him today. And they can't even get the easement access through Oak Brook, through their property. I just find it very interesting. Your planning commission denied this project for reasons, for very valid reasons. I think a lot of them actually came out and saw the properties and how it will affect our neighborhoods. And that's all I have to say.
Thank you.
Thank you.
And that concludes public comment.
Okay, so Mr. Mancy, you have rebuttal time.
Thank you, Madam Chair. I think the only thing that I would say is there are people that do support the project that just can't be here. A lot of them have jobs that would prevent them from being here. There's a gentleman named Miguel Guerrera that lives on Chancellor that supports the project. So that would be my only rebuttal. Thank you.
Supervisor Lavenino, did you have a question for Mr. Mancy?
Might be for staff. What's the status of the MRO? And
Chair Hartman, Supervisor Lavenino, there is a zoning clearance application in for the 160 units in the MRO portion on site. At this point, it's essentially on hold pending the outcome of this particular application or series of applications.
is it owned by the same family? Okay.
Yes.
Great. Thank you.
Any other questions for staff? Supervisor Nelson?
Yeah, I had a question for Mr. Manzi, because, you know, one of the things that's being advertised here is that these houses will be sold for $600,000 or $700,000. How are you able to say that, right? Because it's going to take a while for these to be built. I mean, are there some kind of deed restriction that you're planning on putting on there to make sure it limits that, or are you going to be selling them at whatever the market conditions are at the time that they're built?
Yeah, Supervisor Nelson. Yeah, we don't know. Today, if they were built today, we estimate they'd be sold in the 600 to 700 range. In 2 years, who can say? I don't know.
Okay, I was just curious.
Yeah, they would be definitely under what's being sold today, though, in the area. Thank you.
So, Madam Chair, can I ask Mr. Manzi about the MRO? Just what are your plans, or I'm just curious.
Yeah. So as Ms. Reese said, we were waiting to see what the decision would be on the project before you. If this project is denied today, we would meet and talk with Ms. Reese to figure out how to move forward with the MRO. It's my understanding that some of the things that are being approved today on this project affect the MRO. And so there would need to be some things reworked, I think, in regards to roads and infrastructure before we would be able to move forward.
Okay, well, then I guess that's a question for staff for me, because I know I'm supposed to be taking this as its own project. But the MRO project is already approved, correct?
Chair Hartman, Supervisor Lavenino, that's correct. The focused rezone is approved. So the zoning is approved on the site. And what the LUDC states is that the permitting path for residential development on that site would be by right, so ministerial. And our code specifically says that no discretionary approval or additional environmental review or public hearing can be required for projects in the MRO.
And just refresh my memory, how many units are we talking about?
160 units over 8 acres.
Okay.
It's 20 units per acre.
And what's the access point on the MRO?
Chair Hartman, Supervisor Lavenino, in the EIR for the focused rezone, the project description included access over Oak Brook Lane. Though, as the applicant stated, the Chancellor Road is mentioned in the traffic study that was a part of that EIR. The traffic study was specifically for access, secondary access over Chancellor, while the project description in the EIR doesn't reflect that.
So why would somebody have an easement over Oak Brook for one project but doesn't have it for the other?
Chair Hartman, Supervisor Lavenino, they do not have an access easement. So essentially they would, they don't possess that easement.
But okay, so but if they're be able to build it by right, what am I missing? I'm like, somebody help me out with this.
Yeah, Madam Chair, Supervisor Lavenino. So they have a right to develop that property, but they have only an access easement over Chancellor. So that does complicate it, right?
And they have to have secondary access.
And they have to have secondary access.
Okay, so we're in the same spot we are with this project.
Except we have less discretion. And so with that particular project.
Okay. So is it in your opinion that it is either this project or that project, or do you think?
Well, I guess what I would say is that that project has more, that project is more guaranteed because of a ministerial permitting process that was approved as part of the housing element in the last round. This project, you have more discretion over, I would say. And you do, because it's a development plan
For
and
now.
a map and
Right.
whatnot.
Okay, thank you.
Supervisor Nelson.
Yes, I think I just want to kind of clarify, make sure I understand it right. The Orchid Community Plan called out access to this property, and it was also recognized during the rezone that access would, if secondary access was needed, it happened over Oak Brook. Is that that's consistent with the Orchid Community Plan?
Madam Chair, Supervisor Nelson, that is consistent with what the Orchid Community Plan said.
And that was part of where the Orchid Community Plan said, okay, we will go ahead and allow more density here on this mesa. But in exchange for that density, we're going to direct traffic in a way, and that would be coming down Oak Brook.
Yeah. And Supervisor Nelson, the Orchid Community Plan at the time it was developed did not anticipate the MRO either. That came later as
So-
part of the housing element.
And when the MRO went in as part of the housing update 13 years ago, they didn't change the Orchid Community Plan to move it to Chancellor. They kept it on Oak Brook, correct?
That is correct.
And if I actually have another question while we're there. Mr. Manzi's attorney asserted that we don't have discretion here. So I would really like to hear maybe from County Council if we do have discretion, because if we don't, then it's a foregone conclusion and we need to move on. But I don't know if he was correct with that or not.
Madam Chair and Supervisor Nelson, so we believe the board has discretion over the discretionary permits here. We don't believe the Housing Accountability Act applies in this circumstance because of the need to amend the Orchid Community Plan to change from from Oak Brook to Chancellor. And because it requires that change, we don't believe the Housing Accountability Act applies here.
Thank you.
Supervisor Williams.
So how does that work with the previous project? don't you need access? And typically, I know this because I found this out in previous situations. If you deny access, someone can sue you for a takings claim at very least. What would happen to us if the approved project has no access?
Madam Chair, Supervisor Williams, I think I would like County Council to participate in this response, but it certainly puts them in a position that is problematic in that we have an MRO and we have a ministerial permit process, and they have an easement over a road that is not what is defined in the general plan. So if that creates a barrier, I can see that there'd be probably legal recourse on their end. And in addition, I have questions about what would apply with regard to the Housing Accountability Act, because now we have a ministerial project that all of a sudden can't move forward because of this barrier that's been created. And I don't have all the answers today, but it is certainly something that needs to be sorted out.
Chair, I've dug into this, so I wouldn't mind commenting.
Could we
Yeah.
first go to County Council? I
but
see that they're.
Madam Chair and Supervisors, so even though the MRO is set up to be a ministerial approval, they still have to meet certain standards, one of which fire requires secondary access. It's not really a discretionary standard like compatibility with a neighborhood or something like that. So currently, the applicant doesn't have secondary access that's consistent with the Orchid Community Plan. So if the Orchid Community Plan allowed access via Chancellor, the MRO could be approved right now, assuming that it meets the other standards, but that's not what the Orchid Community Plan currently reads. So they still, to be able to move forward with the ministerial MRO development, need amendment to the Orchid Community Plan. And the county currently is not holding up access. This is a private dispute among various neighbors.
So how is that resolved? Would it have to go to court, an action between the two, or how does the community plan piece of it weigh in?
Madam Chair and Supervisors, so that your board has discretion over amending the community plan, pretty broad discretion. If that discretion was exercised in a way that someone wanted to challenge, that's something they could do. But in terms of access and easements, that would be a private dispute.
Supervisor Nelson?
Yes, thank you, Chair Hartman. That was a concern I had as well. I mean, I've been digging into this for quite some time. The state law has changed for fire code, and actually there's additional discretion the fire marshal has up to 199 units for a single access point. It doesn't have any of the other high fire, even though this is on the edge of the community, doesn't have the high fire danger necessary, and a single access point could be approved by fire. So it could just come out through Clark Avenue and not need a secondary out access if it just built the MRO directly. So I don't mind checking with fire on that, but that's the conversation I've had with the fire chief and the fire marshal, because it did seem like it was a foregone conclusion if we had to go gain that access if this project was not approved. So that's out there as well. So it's not, if this project doesn't get approved, it's no longer a ministerial action. It's still a ministerial action. They could still move forward just like they could have over the last 13 years, to build that, but it hasn't been built.
Thank you. Supervisor Williams.
Madam Chair, there is one other step that needs to occur for them to be able to do that, is the lot has to be created to be able to build on the MRO. The zoning is there, but there is no lot that follows the boundaries of that zoning. So that's part of the approval of this project, creates that lot.
Supervisor Hart.
Well, that's makes it all so clear now. Honestly, I'm baffled. I don't understand how the community plan created this conflict between these things. And it seems like that's what the community plan should have figured out, is how to get access to these parcels to have this development. I'm sympathetic to this applicant just in terms of the process of coming to the county with a
a much less dense project over many acres years ago is the way it was explained to me. I don't know if that's true or not. And the planning and the county and the planning commission saying, no, that's cluster it and have this open space. And now there's this open space and, they can't get approval because of access. And, it just feels like there's no path. And I don't understand how we got here with these two things that are connected, but they're not connected and they have different easements on different streets. And, asking neighbors to say, would you like traffic to come by your neighborhood is a great try. But, I think that was kind of like, they're going to say no, just like the chancellor people are saying no. And so the fire department needs to have access to one of the lots, but not the other lot. And, we need to figure this out, I guess.
Madam Chair, I just wanted to make one clarification regarding the lot. The lot is necessary for financing purposes for the project. It's not something that we would mandate, but it is a necessary element for them to be able to construct that MRO.
I see. So that's not another discretionary decision. Got it. Well, I agree with Supervisor Hart that usually if there's a disagreement about a private easement, the county does its thing and the private parties have to deal with that. But here the community plan says that it should come over Oakbrook rather than Chancellor, right? And so that's what I'm stuck on.
Madam Chair, the community plan does include that. It is a little unusual for a community plan to be specific in that nature about an access, because most community plans are more general. That's where they're general plans, right? So I wasn't involved in the development of that community plan, but they did include it in there.
And it's a specific policy.
It is. Yeah.
I saw your light.
Are we still in questions? Are we?
Well, Supervisor Hart.
I don't have a question. Well, actually, I do have a question. I'm curious what Supervisor Nelson would think is the solution to this, because this is feeling very Solomon-like to me.
It is a tough one. I'm not against development, but I am against development that seems not to really work. In Orchid, we're building like crazy. If you guys have driven through, we put in apartments, we put in single family homes. We've got, either completed or in process or soon to be built over 700 homes in the Rice Ranch area. Keysite 30, we already put one of these MRO properties in there. My chief of staff lived in there when he first moved to our community, and so it's doing exactly what it's supposed to do. And I'm certain that Orchid's going to see more housing through the housing element update as well. And I believe that the reason why this got so messed up was because past boards stuck this out there on a desert island and probably never intended for it to get done, and so it's kind of created this problem that Mr. Manzi has been faced with. And so, it's hard to be, you want to be sympathetic to the applicant, but at the same time, my job is to protect my community. We've got, we're getting a lot of housing. We just don't have a lot of resources and community spaces. And there's just so many things. And, so there's a challenge here. And so as much as I'm sympathetic to it, those apartments never were built in the 13 years. And some of these challenges that we talked about as part of that. I would like to see it. It needs still more work. I think Oakbrook is a better spot because it actually takes traffic away from Clark Avenue and then takes it out on the Stillwell. So then it can actually be delivered into the community towards schools, towards other places. And so, that's why our community plan envisioned Oakbrook as the access here. That was on purpose. That wasn't on accident. Oakbrook was seen as a private road. Oakbrook is as well, but it dead ends. I drove it yesterday just to make sure my head was straight. Dead ends right into this project. Oakbrook has to build a bridge, has to go around Chancellor, he has to build a bridge, has to go through some open space just to connect up there. It will be an unpreferred route for residents there. I think the people that live on Oakbrook, most of them bought their houses since 1997 when the Orchid community plan went in place. They read some of those documents, and I know nobody does, but it was there. It was going to come at some point, whether that was done through a developer going and knocking on their door and offering them money, which I question Mr. Manzi's true intention to get that, how much work that he went into it. If he doesn't even know how much he was going to offer them. Also, that fact that Mr. Manzi and his agents promised the neighborhood that they weren't going to do it in exchange for an easement they needed to complete their project. So it'd be a lower cost option. So they've kind of put us in a really tough position. And if I'm put in that tough position where, I can't comply with my community plan, I think I have to deny the project ultimately. Something else I wanted to add in there was, this project has been admired because look at all this open space that we're going to get for the community. Look at all the trail access. Mr. Manzi reached out to one of our biggest trail advocates, kind of a founding father of the Santa Maria Valley open space, and said, "Hey, I'd love for you to come to this meeting and get your support for this project." And he said, "For the record, I've commented on this project for several years. Nothing I have suggested, cared about, asked for has been incorporated into this project. I think it's a mistake to prove it as is, as it would be another example of poor planning in the Orchid community. This is another example of the frustration that the trail community has in Orchid of not being listened to, not being asked for input, not being taken seriously or taken care of." So even though so you actually literally have our trail advocates saying, we don't even want these trails because it's still a bad project. I think what Ms. Reese is going to come back with, it's going to be a trailhead with six or eight spots. Not very many. Is that right?
No, Madam Chair, Supervisor Nelson, there are some designated spots, and then there's a public road that has multiple spots. It has, I think,
Estimate of 120
20
spaces
spaces.
available.
Yeah.
Yeah, I think our board knows about parking along the right of way and what kind of conflicts that creates. But again, this is something that, I think that the community has spoken loudly to my office, as a representative of it. And there's going to be a lot of people up there on this mesa. When the board asked for this to happen, they were talking about clustering before the MRO. I think that needs to be something that people need to take in consideration. That was when they were talking about 125 clustered units on top of that mesa. This is 287 clustered units. The amount of population on there, although dense, and I can handle density, is about the same size as Los Alamos, okay, population wise. And that's a lot right there. I do want to, it's away from town. There's only one area that's going to take all that population, not against density. I'm just against density in the wrong spots. And this is the wrong spot for this level of density. If it was just one parcel over, one key site over on key site 1, right on Clark and 101, where people can drive in and out, they can have access to commercial things. It's a different project. If it was along 154 and Clark or 154 and Univalle Parkway, different project. In Orchid, we have those spots. This has been a bad spot for a long time. I think all we do is make it worse by approving this project. I think if they want to go ahead and move forward with the 160 units, they have that by right to do it. And it's not within our discretion here today, but to make it 287 units, I think is not the right project. So that's where I'm at, Supervisor Hart, since you asked.
Supervisor Hart.
Well, that is helpful. And let's see what I say about this. Well, it doesn't change the challenge that we have because we've got a project here that's in front of us. And I don't know that anybody has any, well, I shouldn't say that. The density to me is not inappropriate given the clustering and the open space that's being dedicated. I guess that is how I'm looking at this independently from the other project because we don't have the other project and we don't maybe have any discretion over the other project. So it comes down to this access issue. And I appreciate the direction that you gave last time to go explore that. And I supported that. And, I think you're exactly right. I did a site visit on this project and that street is more connected to the urban grid and makes more sense, but it doesn't have an easement and the property owners don't want it. And I don't think there's any amount of money that would really, frankly, change that equation. That's not been my experience. And there is an easement on the other road, and the other road is going to benefit significantly from the open space that's being dedicated immediately behind them. So you're sort of, you live on the end of a cul-de-sac and you got somebody else's private property immediately behind you that you enjoy for 30 years as open space, but is zoned for development. Somebody comes along, develop it. And here we are with the tough call. And I think when I look at all those things, that feels like a path that works. It would be better if the trails folks were supportive of this, and it would be better if there had been more work with those folks to figure that out. And but we never said anything about that in the last hearing that we talked about this project. We talked about the secondary access, and the applicant went to the neighborhood and asked them. He could have come with an offer of money, but again, I don't know that honestly would have changed the equation of this. So where does that leave us? How do we, fix the Orchid community plan and create an access point over private property that people don't want accessed? So I don't know that I have a conclusion from all those remarks, but
I have an additional question. And that is, how much traffic does a secondary access get?
Chair Hartman, members of the board, I think it's best if we defer that question to Will Robertson.
Okay, I see he's on. Will?
Madam Chair, members of the board, unfortunately, I do not have the traffic study up in front of me right at the moment, so I can get back to you if you're looking for an exact number. But from my previous reviews on this project, the majority of the traffic will be going out the main entrance. So there's probably about a quarter of the project would be using the Stillwell connection. But like I said, if you want me to come back to you with an exact number, I can do that. Just it'll be a moment.
And is there any way to encourage use of the main access, or any ways to limit the traffic over the secondary access?
Madam Chair, members of the board, because of the way fire is mandating the access, they require this to be a full-time access 24/7. I'm really not sure if there is a way to focus the traffic towards the main entrance. I think just as a matter of principle, that's the way that people are going to go. It's direct access to the freeway. It's the quicker route. There's shopping, the new shopping center that's being built, as well as Keysite 4 that's already built. It's just probably the better option for most people. But if you were going into the existing Orchid shopping center or to Old Town Orchid, it would just make sense that you would go out Oak Brook if that was the available option, and up Stillwell. Chancellor, I do agree with what was said earlier. If Chancellor is the one that's built, it is a circuitous route. It's not going to be the same feeling. It's going to be slower. It's going to be longer. That access would actually prohibit the traffic more than the Oak Brook connection.
Thank you. Director Plowman, did you have anything more to add? I saw a little conference going on there.
Madam Chair, we were just examining the numbers and discussing what the breakdown might be. But I don't have anything more to add.
And Supervisor Nelson, was your light on from before? Yeah, I haven't changed my position too much from what it was before. I don't really see this as a desert or an island or I mean, it's surrounded by housing of different kinds, the mobile home park, smaller lot, single family homes, ranchettes, and then the 101 freeway. And it's close to shopping centers and a lot of urban development. So I'm a little stuck on the community plan issue, but it seems to me that this is well suited and that the applicant has really in good faith, done what the earlier board asked and done what we asked. And now it seems to deny this would be, at least for me, an act of bad faith. Supervisor Williams?
Well, I mean, it seems like a real tough situation because we have discretion over this project. It continues to seem to me that most of the neighbors that don't want this project, what they really don't want is the project that's already been approved. And we are not allowed to deny access to a project that's already approved. So what could we do in the long run if we denied this project? If we don't provide some access to the project that's already been approved, we will get successfully held accountable either by HCD or by the applicant. Because you can't do that. You can't approve a project and then not allow access. So I don't know how the way out of this either. I'd be happy to condition approval on more trail parking spots, more other things. It's unfortunate because I do agree that secondary access would be better through the other location from a perspective of reduced, vehicle miles traveled as Supervisor Nelson has pointed out in the past.
Supervisor Lavenino.
Thank you, Madam Chair. Well, I think that's the issue that Supervisor Nelson's talking about is, if that's what our goal is when we talk about housing, is to reduce vehicle miles traveled. There's no jobs for those folks right there to go to, right? So they're all going to get on the freeway and head down to the South Coast or to Vandenberg or wherever. So Old Town Orchid can only employ so many people. So I look at it the other way. For me, I don't really see it as surrounded by housing. It might be surrounded by housing, but a completely different type of housing. So, while you do have the mobile home park there, the other folks around there are pretty much ranchettes. It's really interesting. This is kind of a case study of, if this was in the South Coast, we would be saying, hey, you guys should be building it and put it in there. And you guys would be like, oh, it's going to destroy the neighborhood. And if it's up here, we're like, hey, I don't think you guys should be building this. Doesn't fit. And you guys are like, well, we do have to put housing somewhere. So, I think the board made a mistake, quite frankly, years ago. And we've got that hanging over our heads. That project should have never been approved there, the MRO. And what I'm worried about, I don't want to see both of them built. And I don't feel like I have any control. I think it's just too much into one space to put that many units on that piece of property there. If this was somewhere else, we'd be talking about that it's a gateway. It's a scenic view coming in. That's the first thing you're going to see. Right now it's open space, and now it's going to be housing. But putting 280 units or 300 units there is too much. And if I can't control the second one that's coming, the only way for me to really deal with that one, unfortunately, is to take a harder look at this. And for me, it does not have the secondary access. I don't know how you get that secondary access. I agree with you. Somebody comes and knocks on my door and says, hey, I want to drive cars past here. I don't really care what you offer me. I'm not doing it. That's why I live there. So, I'm conflicted because I do agree with you that it feels kind of like pulling the rug out, but you're either pulling the rug out from the developer or pulling the rug out from the people that live next to it that, we're told that this wasn't going to get developed in that manner. So it's a tough one. This is one where, for me, honestly, I could come down either way. But this is one of those instances where, for me, Bob has to answer to those folks in that district. And I will, I have my reasons why I'm supporting you on this, but to me, that's also a consideration.
Supervisor Williams, your light is still on.
Yeah, this is sort of just a not completely this is a side issue. I very much hear both of you on the big picture thing that more housing in the north far from jobs is not the answer. Okay. And maybe it's weird that I would be more likely to turn down a housing project in Orchid than I would be in my own community. But that's because I know that not having enough housing close to jobs is killing the environment. It's killing our diversity. It's killing our next generation. So I just want to tell you, I hear you and I agree with you about that this is a sign of something that was maybe, through one lens, and it's impossible to tell because I'd have to go back and interview our previous colleagues, figure out what was in their thought process, but maybe like just, a convenient place to approve housing. And maybe it wasn't the right place to approve housing. The density though, in the original project is something that I would be proud of in my own community. And I will fight for in my own community. So I don't know where to go, but I just wanted to let you know I'm there with you on the larger issue and agree with you.
Well,
I'm not sure if I have the votes, but I am going to make the motion. It's not easy because at the very beginning I started, I'm pro housing. This does not support my community plan. And I've heard from my community. It's not just the 3 people that are here or 4 people here today from the neighborhood, but I've been hearing about this for quite some time. But I'm going to make a motion to the findings to deny the project. Do we have those up there? So I'm going to make the motion to make the three recommended actions here to from our planning commission and to deny the project.
I'll second that.
would you call the roll? Is there any more discussion, Supervisor Williams?
Well, it's not a secret. I Brown acted with Mr. Nelson on this, and I obviously in every hearing I try to hear out the stuff in the hearing in case it provides us further evidence. But I could condition this project to have more things that are important to the community. I could agree to some other solution on access, but I just can't agree to deny the project. Given what we know about this project and the previous project.
Madam Clerk.
Supervisor Williams?
No.
Supervisor Hart?
No.
Supervisor Nelson?
Aye.
Supervisor Lavenino?
Aye.
And Chair Hartman?
No.
Motion fails 3-2.
So we need another motion.
Yeah, I guess I'll make a motion to approve the project. And I do think it would benefit from additional focus on the trail network and how to better connect that to the community. And, we have a challenge here in accomplishing that. I don't know if we want to have the applicant propose something and take a break. And
let me just ask Director Plowman, do you have findings either way? Is that correct? So
Madam
do
Chair,
we need a
we
break?
do. I think a break would be useful for us to have hear from the applicant, talk to them about what those findings would look like, and then see if they are willing to do additional work with the Trails Foundation.
Can I make a suggestion?
Sure.
If you're going to make a motion to approve the project, that we condition it on some kind of increase in the parking for the trailhead that maybe the applicant could respond to after the break, and some sort of just flat offer to the neighborhood for the easement that Supervisor Nelson was asking for. I mean,
should at least make the applicant should make the offer. It's a better access from a vehicle miles traveled perspective, and that is kind of a big deal in our policies. So that would be my suggestion.
Supervisor Nelson.
Yes, I'm not going to end up supporting the motion, but I can't help make this project better, or at least this. So I think it might work if it does, when you guys do change my Orchid community plan to say Oak Brook or Chancellor, keeping that Oak Brook option still on the table, as well as conditioning the project, if it does go down Oak Brook, to improve Oak Brook as a condition of the project. So I would like to keep that on the table, because I will still be working as the supervisor for that area to see if that can get accomplished somehow. So maybe conditioning it with an or might still keep that option on the table. Again, I can't vote for it. I think it's got to be a hard down Oak Brook or nothing. And then I do think just maybe some back of the napkin math with staff can improve the trailhead. I also know that the trail group asked for a couple other things that are in the record. I actually included an email from John Blanchard where there's a few things there that are really easy asks, like not having the fencing around the basin, because it's a visual area instead of having the stark basin with a fencing on it. You know, maybe it should look nice and natural. And so there's things like that are in the record. If those were added, those would be at least some making the project better. Again, I can't support it, but let me suggest those things.
I think that's all great stuff for the conversation with staff and the applicant.
So 10 minutes, 15, how long do you need?
You after?
Pardon?
Can we trail it to the end?
Oh, okay. Yeah. Good idea. Good idea. So we
do.
Yeah, we do. The police.
That's right.
So we need the motion. We haven't voted on the positive motion yet.
I don't know that
It's conceptual.
Yeah, it's conceptual.
Conceptual,
Okay.
yeah.
So conceptual motion to approve the project, create the new findings for approval, and have the applicant work with staff on the revisions that we talked about.
And I'll second. And would you call the roll once again? I think it's important to have a record.
Supervisor Williams,
Aye.
Supervisor Hart,
Aye.
Supervisor Nelson,
No.
Supervisor Lavenino,
No.
Chair Hartman.
Aye.
Motion passes 3-2.
Okay, so we'll have a break and then we'll come back and hear the final item and then we'll trail this and finish it up. Yeah, 5 minutes only.
You want to meet outside?
Good afternoon. After a short break, we're reconvening the Santa Barbara County Board of Supervisors meeting of May 10th, 2022. Madam Clerk, would you read item 7 into the record, please?
Chair Hartman and members of the board, departmental item number 7 is from the Sheriff Coroner's Office. It is a hearing to consider recommendations regarding the introduction of an ordinance adopting the Santa Barbara County Sheriff's Office military equipment use policy.
And Sheriff Brown, you're on Zoom. Did you want to introduce this item?
And Sheriff Brown, my apologies. Great, thank you.
All right. Sorry about that. Yes, good afternoon, Chair Hartman and members of the board. Sorry I can't be with you in person today. I had several meetings all across the county and it just didn't work out. So, but in any event, I'm here today to introduce this item to you. We're here to talk about Assembly Bill 481. 481 requires a public hearing on the adoption of a military equipment use policy. The legislation requires a law enforcement agency to obtain approval from its applicable governing body by the adoption of a military use equipment policy that by ordinance will be adopted at a regular meeting held pursuant to open meeting laws. And this is required prior to taking action related to the funding, acquisition, or the use of the equipment, or the continued use of equipment that has been obtained previous to January the 1st of this year. It identifies certain specialized military equipment it identifies certain specialized law enforcement equipment as, quote, military equipment, end quote, and it requires oversight from the board for the purchase and use of what this bill has deemed to be, quote, military equipment. The law requires the Sheriff's Office to create a use policy, which we have, Lexipol 707, that has been, that we're putting forward today to be adopted by the Board of Supervisors after holding a public meeting to seek public input. The purpose is to increase transparency, accountability, and oversight regarding the acquisition and the use of this type of equipment. AB 481 also requires an annual report that summarizes the use of the equipment, internal audits, and any community feedback. The legislation has dubbed these items as military equipment, but the reality is that the equipment we have has been in use for years and historically has not been obtained from the military or as military surplus. The only actual military equipment per se that we have that meets the definition in AB 481 that we've acquired for public safety use from the military have been our helicopters and our MRAP rescue vehicle. To dive deeper into the purpose and the use of this equipment, I'm now going to turn the meeting over to Commander Eric Rainey, who's the Law Enforcement Operations Commander for our North County. He'll be followed by Lieutenant Joe Schmidt, who is our training lieutenant, and I'll be back at the end to summarize and wrap up the meeting. So take it away, Commander
Thank you,
Rainey.
Commander Rainey.
Thank you, Chair Hartman and Board of Supervisors. Happy to be here with you today. As the Sheriff indicated, I'm the North County Operations Division Commander. Part of my duties is as our agency's policy coordinator. So that's why I'm with you today. Lieutenant Schmidt to my left and I developed this policy with our policy partners at Lexipol. So I just wanted to take a minute to go over the policy itself. The purpose of the policy is to provide guidelines for the approval, acquisition, and reporting requirements for military equipment per the applicable government codes 770, 71, and 72. The policy itself defines military equipment as per government code 770. Items such as unmanned aerial systems or drones, command and control vehicles, battering rams, kinetic energy weapons, specialized firearms, they're all denoted in the policy itself. The attachment to the policy itself, is our military equipment inventory itself. So it's a very comprehensive list of all of the military equipment that's defined by those government codes that the Sheriff's Office is either currently seeking or currently has in its stocks. The policy itself and that inventory governs the use of the equipment. It has a description of the equipment, the purpose and authorized uses of the equipment, as well as the cost, the training, and the procedural rules for its use. The policy in the inventory list outlines all of these equipments in very clear detail. Policy itself outlines the duties of the military equipment coordinator. It directs the sheriff's office to designate a military equipment coordinator. We've designated that position to be our training bureau lieutenant, which Lieutenant Schmidt occupies at this time. The coordinator will be responsible for tracking the inventory, coordinating an annual community engagement meeting, preparing an annual report for this body, and establishing a procedure for the public to register complaints or register inquiries about our military equipment use. The policy also clearly defines the timeframes in which the sheriff's office will present the annual report, have these community engagement meetings, and other mandates in accordance with the new law. So I think one question that may come up is, what is the impact on public safety for the implementation of this new ordinance and our policy? And I would suggest that it will not have any new impact on public safety, because this is equipment that the sheriff's office already has in its equipment stocks, and it's already things that we've been using for years. So really the adoption of this ordinance and the policy will just allow the sheriff's office to continue with the great work that we do protecting the public on a day-to-day basis, as well as when we respond to critical incidents. The specialized equipment that's already in use by law enforcement agencies, ourselves, as well as other agencies throughout the county, and the contract cities that the sheriff's office currently provides law enforcement services to. The equipment itself is needed to prevent the escalation of violent situations from becoming a threat to the safety of the community, law enforcement personnel, and the suspects that we're engaged with. This equipment helps limit and reduce high-risk encounters with violent suspects, and it provides life-saving tools and options during natural disasters or other non-criminal responses. And as I mentioned, the inventory list that defines the purpose of each of these pieces of equipment is pretty comprehensive. And under the purpose section in that inventory list, you'll see things such as purpose being preservation of human life, search and rescue operations, natural disaster response, rapid response to catastrophic incidents, reducing the likelihood of injury to the public, and so on. So these are really tools that we use to try to reduce harm to the public and protect our deputies and civilians alike. So I'd like Lieutenant Schmidt to share with you a couple of incidences that we've experienced at the sheriff's office where we've utilized some of this equipment that's in question today. And so I'm going to turn it over to Lieutenant Schmidt.
Good afternoon, Chair of the Board and Board of Supervisors. My name is Joe Schmidt, and as Commander Rady mentioned, I'm the lieutenant of the Sheriff's Training Bureau and the Special Enforcement Team, which is our SWAT team. I'll briefly touch on two critical incidents where this equipment was used to protect lives and safeguard the public. One of the most significant uses of this equipment was the deployment of the MRAP and Bearcat rescue vehicles following the 1-9 debris flow in Montecito. The MRAP and Bearcats were immediately deployed to the disaster zone to conduct rescues. No other vehicles in the sheriff's fleet were able to access these homes due to mud, rocks, and other debris in the roadway. All sheriff's armored vehicles rescued approximately 30 trapped community members and their pets, bringing them to safety. And as you can see in this picture, our Bearcat vehicles were involved in numerous rescues of trapped victims, such as this elderly couple who were evacuated from the second floor of their home due to the front door and the first floor being inundated with mud. It was the only way to access them. In 2019, we utilized Bearcats and distraction devices to rescue a hostage being held captive in an RV, and this occurred in Buellton. On November 26, 2019, the special enforcement team responded to a suspect holding his elderly mother-in-law hostage. The suspect had kidnapped his wife and mother-in-law and led CHP on a lengthy vehicle pursuit. The pursuit ended in Buellton, where the suspect's wife was able to escape the vehicle, leaving her elderly mother inside. The suspect, armed with knives and a bludgeon weapon, held his mother-in-law hostage inside the RV. Both Bearcats were used. They were deployed and used to block the suspect's vehicle to prevent a second pursuit from occurring. Negotiators with the sheriff's crisis negotiations team then spent over 1 hour attempting to communicate with the suspect to de-escalate him and to let the the hostage free, but the suspect refused. Concerned for the safety of the hostage, the special enforcement team deployed 3 distraction devices near the driver's side of the vehicle in order to distract the suspect as the rescue team entered the RV. As a result, there were no injuries to the hostage, law enforcement, or the suspect. And here's an image of the narrow doorway used by the special enforcement team to enter the RV and rescue the hostage, while 3 distraction devices distracted the suspect. And I will now turn it back over to Sheriff Brown to conclude this presentation.
Thank you, Lieutenant Schmidt. To wrap up, the justification for the use of this equipment. This equipment is equipment that is necessary because there is no reasonable alternative that can achieve the same objective of both officer and civilian safety. And the proposed law enforcement equipment use policy has been written in such a way that it will safeguard the public's welfare, safety, civil rights, and civil liberties. The equipment is also found to be reasonably cost effective, and so that it compared to available alternatives that could achieve the same objectives of officer and civilian safety. So with that concludes our presentation to you. We're happy to answer any questions that you might have about the policy.
Do any board members have questions? Supervisor Hart?
I don't have questions, more of a comment. I think this is actually kind of an interesting opportunity to talk about, this is the exceptional moments that you captured when you need to use this equipment. And it's important that you have these tactical tools when the circumstances present themselves to protect the public and the officers involved in dangerous situations. But this isn't the norm. This is what the normal interactions you have with the public are not as challenging as these examples. And I just thought this is a great opportunity for you to talk about that, about how you lead with the de-escalation of force rather than this extreme example of the most sophisticated use of technology when force is required. And I think that balance in the conversation with the community is important. And this is a great opportunity, even though we're talking about tactical weapons and military capabilities, for you to talk about what you do on a daily basis, really about de-escalating force and engaging the community. And even I thought about these instances when you do have to use this equipment. Obviously not the debris flow is not a good example, but when there is a tactical situation, is there a mechanism to communicate to the public about what happened? Because these are extraordinary things that get covered by the media. Folks don't necessarily know in their own neighborhood how things were resolved. But is there a process that the sheriff's department goes out and explains, this is what happened. We had to bring this tool in to your neighborhood and we resolved the situation, this way, and just to close the loop with that neighborhood about what happened, so that folks, if they have questions that are lingering in their mind, there's even potential trauma amongst the civilians that are involved in something like that. And is there a way to de-escalate that? Bunch of questions packed in there. Sorry.
No problem, Sheriff. I'll go ahead and take a stab at the answers here. I think you bring up a lot of great points, Supervisor. We'll see if I can answer all the questions first. We do have a use of force policy that very explicitly directs de-escalation as the first step in any encounter that might need use of force. So all of our training in the sheriff's office, any use of force type training, as well as our critical incident training, is focused on de-escalation as a first tool. And like you pointed out, all of this equipment is really there for the extreme cases. This inventory list, really, if you look through it, not a lot of it is used in our day-to-day operations. Most of it is used for those critical incidents where our de-escalation efforts are unsuccessful, or when the situation itself brings itself to us in a level that requires us to act in that fashion. So you bring up an excellent point, and I appreciate you pointing that out. As far as the follow-up with the communities, when we do have an opportunity to come out and resolve a situation that's unusual in nature, we use our public information officer to put out a press release and engage with the community on our social media sites so that the public's aware. I think what's unique about this new legislation is it will have an opportunity for us to come to this body on an annual basis and report out on the use of any of the equipment that's defined by this new law as military equipment. So the public will have an opportunity to see what we've used throughout the year and in what situations. But I actually will take back to my shop the note about being able to get that information out to the community in a more timely manner. So thanks for putting
Well,
that
thank
out.
you for the great answers to the questions. And, I do think this is a great opportunity to help educate the public about, the context of these things. And so next time when you come back, you take advantage of the opportunity with the PowerPoint to, have some more descriptive information in there that can help folks understand this context. Thank you.
I had a few questions, just more practical. Is this secondhand equipment or is it produced for military use and police and sheriff's departments get new equipment produced specifically for them to use in this way?
Thank you, Chair Hartman. Regarding the equipment, most of it is new equipment purchased from various vendors. As Sheriff Brown mentioned, the only equipment we've received that falls under the military equipment from the military was the MRAP rescue vehicle. And that was, if it was used at all, was briefly used before it was donated to us.
And does it have to be retrofitted in any way for civilian use?
No, the equipment in the case of the MRAP is just an armored rescue vehicle. It's a similar application to the Bearcat rescue vehicles or ARVs, armored rescue vehicle, and used for the same purpose. It's armored to protect from ballistic, from small arms fire, rifle fire, and it's also, as we use in the mudslides, extremely off-road capable with a high clearance and can traverse all kinds of terrain.
I had an opportunity to see the Firehawk, which is retrofitted for sheriff and fire. And Sheriff Brown was at the expo where it was presented this past weekend. So that's an example of a really valuable piece of military equipment that has been retrofitted, and it was actually put to use on the Patera fire over the weekend, I gather. Were there any other questions that board members had? Comments?
I've got a couple comments. Initially, when you're hearing about military equipment, there's a concern about the militarization of our local community law enforcement group. And, when you have, I think Supervisor Hart really put it out there that, we want to move more and more towards community policing. And then there's this other side, and this is the worst side out there. And, so for me, I paused when I was reading this to think about, you're asking for our endorsement essentially with this policy. And, it is a world that exists right now where there are a lot of challenges and a lot of bad people that want to do bad things to our residents. And so at the end of the day, I trust the men and women of the Santa Barbara County Sheriff's Department to use force and use this equipment judiciously. And so that's why I'm really comfortable with supporting these policies. So I just wanted to make sure that I said that informed my constituents, because I do think that sometimes it can seem very unsettling to see this type of equipment in your neighborhood. But at the end of the day, I think it's the relationships that you have with the public that really transcends that, and really make sure that people change their mindset and realize that you're there to help. And so I think that's really important.
And I think the policies obviously frame when and how these things would be used. And that's really detailed. How long have you been working on that?
Chair Hartman, it's been about a 4 to 5 month process of putting together. It's a new situation for law enforcement all over California. So we're learning as we go, but it took a while to get an accurate inventory of everything because there's quite a bit of various equipment we do have in use.
And was that the hard part, or figuring out when it should be used? I mean, the policies around it, that seems, is that, I mean, do you share with other departments, other sheriff's departments across the state, or?
Chair Hartman, yes, I've been in communication with other agencies throughout California because again, it's new uncharted territory for us. So we're sharing information as far as the equipment, like Commander Rainey mentioned, it's equipment we've used for so many years. So we know when to use it, when it's appropriate and when it's not appropriate. It was a matter of putting together the policy and making it very detailed and available for the public to view.
Well, it's really a good document. So I think we are ready to see if there's any public comment. Madam Clerk?
Chair Hartman and members of the board, we have no requests to speak on this item.
Okay, then we could use a motion approving staff's recommendation, which is A through D on our agenda.
So moved.
Second? All in favor, say aye.
Aye.
Any opposed? Passes unanimously. And so we have the trailed item. Thank you.
Thank you, Supervisors.
Chair Hartman and members of the board, if we can get an additional 15-minute break and then return for departmental item number 6.
Okay. Good afternoon. After a short break, we're back at the May 10th, 2022 Board of Supervisors meeting. And we trailed one item, number 6 in our agenda. Madam Clerk, would you reread that into the record?
Yes, thank you, Chair Hartman and members of the board. We are returning to departmental item number 6. This is from Planning and Development. It is a hearing to consider recommendations regarding SB Clark LLC Residential Subdivision Key Site 3, General Plan Amendment 13 GPA 5, Rezone 13 RZN 1, Vesting Tentative Track Map 13 TRM 1, Development Plan 13 DVP 10, Road Naming 17 RDN 5.
Director Plowman?
Madam Chair, members of the board, we do have some slides to share with you on some of the corrections that we have made based on the direction of the board. Ms. Reese worked furiously during the break to get these slides prepared. So with that, I'm going to turn it over to her and let her present them. We're happy to answer any questions.
Thank you, Ms. Plowman. Members of the board, we have a number of project description changes that were made during the break. The first of which is to clarify that the primary access easement that comes from Clark Avenue, there's an existing easement in a location that's less preferable to the owners of Key Site 2 and the mobile home park occupants. So there is a renegotiated access easement that hasn't been signed. So this change to the project description is just clarifying that there is existing access and it'll remain over the existing easement if it's not recorded. However, if it is recorded, the map can proceed or, reflect that change. And the findings are updated also to reflect that distinction. The other project description changes relate directly to the deliberation prior to the break. So namely, we spoke with the applicant's engineer and the applicant, and they have agreed to provide an additional 15 to 20 trailhead parking spaces in the existing landscape buffer area between where the existing trail parking spaces are proposed and Highway 101. But that's dependent on the engineering constraints and consistency with development standards to require or to provide that landscape buffer, require certain drive aisle widths, et cetera. But they think that that number of spaces is feasible. The other project description changes, they have agreed to install a 6-foot tall sound wall between the primary access road and the 101. So where the 101 parallels the primary access road and the Sunny Hills Mobile Home Park. Additionally, the applicant will incorporate decorative fencing and additional native landscape screening around the basin. So the basin is 14 feet deep currently, and that's why it's required to have that fence around it. It's required to have fencing around it unless it's less than 18 inches deep for safety. So they're going to explore a more aesthetically pleasing approach given the constraints. Lastly, the applicant will make a good faith effort with an offer of monetary compensation to gain secondary access over Oak Brook Lane. And if required, the applicant will improve that road to applicable standards. That takes us to the changes to the general plan amendment. So they have been revised based on the direction from the board to reflect a secondary access road from Oak Brook Lane or Chancellor Street rather than in lieu of in both locations where Oak Brook Lane is mentioned. And lastly, we have the revised recommended actions based on the memo that was docketed and posted online to incorporate all of the changes that have just been presented. Oh, and lastly, I just wanted to make some clarifications on a few slides. So here, the first sentence says the applicant endeavors to obtain a remediated access easement. It should say renegotiated access easement. And the second change is on the last bullet point here, there was a sort of run-on sentence that was inserted in the flurry of making these changes that no longer stands. So that has been removed from this particular slide, but that's how it differs from what was docketed online. So we'll clarify that in the action letter as well. Thank you.
Thank you. So are there any questions about these changes? All right. Oh, Supervisor Nelson.
No, I just wanted to comment that I appreciate staff and the applicant and my colleagues to try to do their best to move this along. Thank you.
Supervisor Hart.
Well, I will make a motion to approve the project with the project description change as described by staff with the new general plan amendment and the recommended actions. And do we need, I guess we need the original construct of the.
Madam Chair, members of the board,
letter?
why don't we help you by,
Thank you.
since the
Be
motion
great.
has changed,
All
I think
right.
that needs quite a few steps now for approval. A couple of items, since we did produce new items with including changes to the project, I just want to make sure there's no public comment.
Okay.
And then I do want to confirm that this new memo with the findings is up online before we conclude with public comment. So if we want to maybe just check on the motion.
Madam Clerk.
See if there's any public comment.
Chair Hartman and members of the board, I'm not seeing any public comment. I'm not sure if we wanted to hear from the applicant themselves. I know they did work with the department on this item. And in addition, we did post the revised slides, but we just received the memo and are currently posting that. So that should be up momentarily. And I can let the board know when that is posted.
The extra slides are up. Bishop. Or Joe Bishop, Jill Bishop. Yeah, that red name is about that. Context. I noticed it. There's in general. For enthusiasm, so that's involved. All we need is 2 or 3 of those to talk to their friends. It is tough when you host something like this for some people from out of town.
We're all getting a little antsy here.
To frame it about being against the opponent. No, it wasn't Bont. It was the guy that's getting recalled.
Yeah.
Oh,
The one in LA. No. And apparently, he's losing. But he's going to try and frame the campaign, the remaining part of the campaign as being, if you're getting rid of me, you're getting this. I don't know if there's ones, but that's what's sort of with news. This nut Larry Elder is going to be governor. You may not love me, but I really don't like him. It's kind of an interesting strategy if you can pull it off. Less of a referendum on you, and more of a referendum on the bad guy. I don't know if that works in San Francisco.
Don't they have multiple candidates in that race?
Chair Hartman and members of the board, perhaps we should take a brief break while we're waiting for it to post. Okay. Just as a friendly reminder that we can pick up everything in the room, so we can hear the chatter.
So after a brief pause, we're ready for a motion on item number 6 on today's agenda.
Yes, and Chair Hartman, members of the board, before we proceed with that motion, I did just want to note for the record, we have posted 2 additional attachments. They are listed as attachment 11 and 12 online. The extra slides with the revised findings and recommended actions, as well as a departmental memo that is associated with those findings dated May 10th, 2022.
Thank you. Supervisor Hart?
Yes, I do think I need help with the motion. I have lots of paper here. So maybe if council could describe what it is you want in the way of a motion, I can say yes.
Madam Chair, members of the board, So the recommended action is now displayed on the screen and it'll be showed on the televisions as well. And so that incorporates all of the pieces that you would need for an approval,
Perfect. Thank you.
including all of the changes that we went over today.
Through G.
I will make a motion to approve A through G as recommended actions on the slide that's in front of us. And want to thank staff for working hard to try and find a place that accommodates some of the interest of the mobile home park owners and the trails community. I know this is not a perfect project, and I know there are serious concerns from many people in the community, including our colleagues on the board, and respect that. And we'll make this motion.
I'll second.
Madam Clerk, would you call the roll?
Supervisor Williams,
Aye.
Supervisor Hart,
Aye.
Supervisor Nelson,
No.
Supervisor Lavenino,
No.
and Chair Hartman.
Aye.
Motion passes 3-2.
Okay, we are adjourned to Tuesday, May 17th in Santa Barbara.